Please,
Morning, my lady.
Morning, my lady.
good morning, Judge.
I please the court, my lady. Morning.
Are we ready to start? Mr. Hodes, are you ready?
My lady, we are ready.
Okay, thank you. Nelisiwe, please place the matter on record.
Thank you, Judge. Today is Tuesday, the 2nd of May, 2023, calling the matter of Life Esidimeni Inquest, case number I-001 of 2021. Thank you, Judge.
Thank you very much.
Thank you, my lady.
Yes.
The next witness will be Mrs. Kedani Mashlangu. Her evidence will be placed on record by her legal team. As a court, please, my lady.
Thank you.
Morning, my lady.
Good morning.
The witness is ready in another room, my lady, on the same floor, and we are ready to proceed, my lady.
Yes, can she show herself?
I'll send somebody through to assist her.
Okay.
I believe she is on, my lady.
Come again?
I believe that she is on, my lady. Ms. Mashlangu, would you confirm your appearance?
Yes, we have to see her. I have not yet seen her face. Can is it me alone, Miss Mokajwa? Can you please just
I can see her from the side.
can you all see her? Is it me alone who can see her?
I can see her on my
I can see her, my lady.
I can see her as well, my lady.
Yes, perhaps I should just let me log out. Okay. Thank you very much. Good morning, Mrs. Mashlangu.
Good morning, my lady.
Yes, how are you this morning?
I am fine, thanks. And how are you?
Okay, thank you so much. Elisiwe, please let administer the oath to the witness.
Thank you. Ma'am, please state your full names and surname for the record.
My name is Esidimeni Mashlangu.
Do you have any objections to taking the prescribed oath?
No, I don't.
Do you swear that the evidence you're about to give will be the truth, nothing but the truth? If so, please raise your right hand and say, "So help me God."
So help me God.
You are hereby sworn in. Thank you, Judge.
Thank you so much. There are certain things that
by way of introduction, it is
just
our
before you
intention.
start, Mr. Hodes, you
Yes,
are
madam.
interrupting me. Yes. Ms. Mashlangu, there are certain things that I need to explain to you prior to you giving evidence. Please listen attentively. Because you are an interested party in these proceedings, I need to explain to you that as you have been called to testify, questions will be put to you for you to answer. If the answer to the question or questions will likely incriminate you, you have the right not to answer that question and tell the court accordingly that you fear incriminating yourself. Do you understand?
My lady.
Do you understand?
Yes, I do, my lady.
Okay, thank you so much. You may proceed, Mr. Hodes.
Thank you, my lady. My lady, just to give everybody the structure of Ms. Mashlangu's evidence, it is our intention to take her first by way of introduction through her roles and responsibilities within the ANC as a leader, Thereafter, my lady will be covering her statement that was made at the arbitration proceedings, followed, my lady, by her warning statement, and finally the chronology that was uploaded on our behalf, my lady. So as long as everybody understands that procedure, then I'm ready to begin, my lady. May I proceed?
All right, you may proceed.
Thank you. Ms. Mahlangu, please could you explain to this arbitration your roles and responsibilities as an ANC leader, beginning with the Provincial Executive Committee and the Provincial Working Committee?
I served in the ANC Provincial Executive Committee piece in Gauteng from 2002 when I was co-opted. Subsequent to that, in subsequent conferences, I was then elected as a directly elected at conference as a PEC member. And I think in the latter part, I was...
Just before we start, I hear an echo. I don't know how your systems are, or is it me alone? I can't follow the evidence of this witness. Is it me alone, if I can find out?
My lady, I think it's not coming clear. I'm sending my attorney to put the computer closer to her, and I think the audio will be better. She'll be there in the room to assist her, and then she'll come back to us.
Okay. Any other person experiencing the same problem?
Yeah, my lady, myself from advocacy bar as well. Even my senior advocate holders seem to have a bit of acoustics.
Yes, correct.
Well, I also experienced an echo.
Can we deal with that, Mr. Hodes?
Yes, am I clear now?
Thank you.
If I sit like this. Can you hear me clearly now, my lady?
Somebody is walking from your side. Okay. Continue, let's hear. But the problem is also on the witness side. Okay, come again.
If I speak like this, my lady, is it clear?
Yeah, just continue again.
My lady, my attorney was walking into the room. She's now seated. The witness is in the room on the other side of the passage.
Yes, yours is fine now. Can we check from the witness side if she can just say something?
Ms. Mahlangu?
I can, sir.
Yes, just say something. No. Just say something. Good morning, something, what?
Good morning, my lady.
I think it's much better. If you can start again, Mr. Hodes.
Thank you, my lady. Ms. Mahlangu, we'd like to begin with your roles and responsibilities as an ANC leader. And the beginning point, as I previously stated, was within the Provincial Executive Committee, more commonly known as the PEC, and the Provincial Working Committee, which is more commonly known as the PWC. Would you please begin there? But please speak slowly and clearly into the microphone so that everybody can hear you and take notes. Thank you.
Just before she responds, can you all hear her? I've got no problem. Can you all hear Mr. Hodes? I think he's much better now. Okay, proceed.
Very clearly, my lady.
Yes, proceed, Ms. Mahlangu.
My lady, I was co-opted to the Provincial Executive Committee in 2002, and subsequent to that, I was elected to the Provincial Executive Committee in respective conferences of the African National Congress. And later on, I was also being a PEC member in the conference that took place, I think, in 2010 or so. I then served I was elected as a PWC member. Those responsibilities meant that I will attend PEC meetings, which were chaired by Mr. Shilowa and David Makura and Paul Mashatile, respectively, at different times throughout those years I served as a PEC member. And also serving as a PEC member, it required that besides attending PEC meetings, it meant that I attend working committee meetings every Monday. It meant that I attend to deployment in respective ANC structures across the province or to the region where I was attached to, which either was Mitweding then, and later on it became Esidimeni, and later on it became Johannesburg. So it required that I should go to those meetings frequently, sometimes every week, sometimes every 2 weeks, and all of that. And I also served. I was appointed to serve, to chair respective committees, being the economic transformation, because I also have an interest in economics and finance. In my studies, I also served as a chairperson of the local government forum when I was MEC for local government. I also served in the chaired the health and education subcommittee of the PC. I also served as an ordinary member of those subcommittees at every given point in time in those 20 years that I served as a provincial executive committee member.
Can you tell the inquest which subcommittees you served on as a member or as a convener during this period?
The committees that I served in as a convener was the Economic Transformation Committee, which was looking at the economic policies of the ANC and ensuring those that are aligned and they are implemented by those deployed in government. And the local government forum also I chaired or was a convener of that structure at the time when I was MEC for local government. Again, those was to make sure that Gauteng municipalities and ANC deployees who are mayors are able to execute their responsibilities in line with the manifestos and the things that the ANC had undertaken to deliver to the people of Gauteng. The elections manager also was the election manager, meaning that I convened the election structures throughout the province and in ensuring that they mobilizing them and ensuring that the ANC wins election. Health and Education Subcommittee, I also served there as the chair of the subcommittee, which was also bringing education and a few other departments within that. The committees where am I slow enough? Sorry, I sometimes I'm okay, Judge.
Yes, continue.
Okay, the committees where I served as an ordinary member. Later on, I was also an ordinary member of the election subcommittee. Then I was responsible for a subcommittee.
Just a second, I think that echo is still there. I don't know. Can you hear her properly? Clearly.
My lady, it's Advocate Sibara. This echo, I've got reasons to believe that my senior is sitting at Mazel's chambers. We had the same problem with Dr. Manamela, my lady. I think it's the problem of the building.
Oh, okay.
Thank you.
It's fine, but can you hear? If you can hear, then we can proceed.
We can hear, my lady, even on my side, but the echo is still there.
Is it possible for her to change her position, Mr. Hodes? Because I don't think all of us can hear her properly.
Her position, do you mean a seating position where she is, or to another venue? Because another venue will be difficult.
Can you all hear her, or is it Mr. Sibara alone?
Sorry, my lady, but she's also coming through inaudible on our side.
Judge, it's Nelly. Can I just suggest that Advocate Hodes rather mutes himself when the witness testifies?
Yes, I think so. And he seems also to be far when he talks. I don't know.
Let me try muting my lady and let her continue, and then I will.
Yes, but I also have a problem with you. Also, I can hear you, but you are not coming out that clear. You seem to be very far from, I don't know, from the mic or what. I don't know whether the others experience the same thing.
Hear my lady?
Yes, yes. Thank you.
I've gone on to another microphone, my lady.
Please mute yourself when the witness testifies.
I'll do so, my lady.
Okay. Yes, continue, Ms. Mahlangu. And perhaps you should also try to be slow for purposes of those who are taking notes.
My lady, I speak very fast in general, but I will try.
Just continue. We'll have the record. It's okay.
So I served in the elections subcommittee later, but I was responsible for the research work in relation to the elections work. I also served in the Social Transformation Committee and the Economic Transformation Committee as an ordinary member. So those were my brief explanation on my role in those committees.
Thank you.
My lady, can you hear me now?
Yes, continue.
In those subcommittees, how often did you attend meetings?
Some meetings were on monthly basis. Some will be on every 3 months or so. But the activities of the committees will be as frequent as possible, whether it's a program that is being run in this region or that zone. So those activities will be continual as per the invitation from those structures.
And
I think Mr. Hodes must just not forget to mute himself, because immediately after you have posed a question, you can just mute yourself to let the witness evidence be clearer.
As your ladyship pleases. Now, Ms. Mahlangu, as a PEC member, where were you deployed?
I was deployed in the latter part of my serving in the Provincial Executive Committee. I was deployed in Johannesburg region, which probably is the biggest region of the ANC in Gauteng. Before that, I was deployed in Esidimeni, and I was deployed in what is called Midering, then now it's Pretoria. In Johannesburg, where I was deployed, I needed to be, first of all, every Monday when we prepare for elections. I think the period we're talking about from 2014 up to 2016, we were meeting on weekly basis, attending 7 o'clock meetings every Monday, and thereafter I go to the zonal RET meetings in Johannesburg, regional elections testing meetings, and thereafter go to the zonal meetings, which was in my constituency in Kliptown, to attend elections meeting there, and also to deal with other issues that may arise from time to time in my constituency. Those meetings will be on weekly basis, and sometimes over the weekend when there's election program.
And what was your role in the ANC election subcommittee?
Initially, I was I've always been a member of the elections structures of the ANC as early as probably after 1994. Sometimes I would serve in different subcommittees at Luthuli House, and then in the province specifically, I served as an elections manager, and subsequently I was the head of research when the committee was chaired by Dr. Gwen Ramogopa as the elections manager. That is up to leading to 2016.
And were you involved in the Siyankoba rally at the FNB Stadium?
Yes, as part of preparing for any elections work or any political party that does election work, as part of you showing your strength towards the election day, we had to organize a Sengoba rally. As all of us know, what's the capacity of the stadium. So I was part and parcel of that team that was involved in mobilizing and ensuring that the volunteers are able to attend in coming to that rally, which was held on the 3rd of June 2016.
And on a national level, did you attend any meetings?
Yes, I used to attend meetings at national level. As an elections manager, I'll attend meetings in Luthuli House. I think they were every month or every 2 months, if I'm not mistaken. And I'll attend health and education subcommittee meeting. I'll attend the economic transformation meeting. Depending on which committee I served at, at the provincial level at any point given in time. That's what will be my responsibility and relationship with the national structures attending those meetings. But before all of these, in 2003, I was appointed, I was part of the elections team, which was election manager was Manedi Pijo. I was responsible for the sectoral work and establishment and engagement of a lot of other communities, including the Hellenic, Italians, and Portuguese. That's where the birth of that structure came from. So I've always been involved in elections, national or provincial, in one way or the other.
And were you involved, Ms. Mahlangu, in the ANC caucus?
Yes. I was a member of the caucus. So when you are elected into the provincial legislature, you are a member of the ANC, and you are sworn in as a member, then you are a member of the ANC caucus, which is where we discuss issues relating to the delivery and then all of the political work that we need to do in our respective departments where we're deployed. And also in that committee, I'll also attend the subcommittee ANC study group, which in this instance, I'll attend the health study group, which was chaired by Comrade Nompi Nhlapo. So whenever they're having meetings, and also part of the ANC caucus will be attending to the constituency work area that I was deployed in Kliptown, which is on 3, and doing government parliamentary work, as well as mobilizing and working with other government departments to assist in resolving the issues of the community in that area. And lastly, as a member of the caucus, was to attend the political education sessions whenever they were organized by the caucus. And from time to time, there'll be sessions that are organized once a month for topical discussions in that regard.
Thank you. Now turning to the one of the key issues here, can you tell this inquest what dates you were the MEC for Health?
Maybe just let me start. I was an MEC. I've served in the cabinet of Gauteng for 12 years, 8 months. I was deployed from 2004 to 2009 as MEC for local government, and from 2009 after election till 2010, and I will explain why, because it doesn't have the 5 years. I was deployed to the health and social development portfolio, where social development and health were merged together as one department, being served by one MEC, not as one department, but being served by one MEC and having 2 HODs. And then in 2009,
Can I stop you from here? If I understood this question, the question relates to you, your period as an MEC for health. Am I correct, Mr. Hodes? If we can just confine that to the question, because now you're telling us about local government, this many things.
Yes, my lady, but at least
from which time? No, it's fine. You said you were talking about health and social portfolio. From what period to which period?
Yeah, Ms. Mahlangu, maybe it's easier if we do it on a time period. So if you can start, you said from 2004 to 2009, you were the MEC for local government. Then 2009 to 2010, you're the MEC for health and social development.
Which years? 2009?
9 to 2010, my lady.
2009 to 2010.
Yes, my lady. And then from there in 2010, can you tell this inquest what position you held as MEC? Where were you MEC of what?
From 2010 to 2012, 2010 November to 2012 around July, I was the MEC for economic development. From 2012 to 2014, I was MEC for infrastructure, so-called public works.
That goes slow. From 2012 to
2014, I was MEC for infrastructure, what is popularly known as public works.
And after that position in 2014?
And in 2014, after elections, I was redeployed back into the Department of Health. And the importance here is that social development was now no longer part of the being served by one MEC. It was separated to be a single department.
So in summary, you were the MEC for Health from 2014 to 2017. But how many times did you hold the position?
Just a second. I'm sorry, Mr. Modest, to interrupt. You have just told us that you have been redeployed as an MEC in the Department of Health from 2014, but we don't know until when.
Until 2017, my lady, when I resigned on the 1st of February 2017.
Continue, Mr. Modest.
Thank you. So, Ms. Mahlangu, how many times and for what periods did you hold the position of MEC for Health?
I held the position on two stints, 2009 to 2010. To be exact, 2009 May, after elections, up to November 2010, and from May 2014 to the 1st of April 2017. And
come again?
From May 2009, I was appointed MEC for Health and Social Development up to November 2010. And from, I think, November 2010, I came back to the Department of Health in May 2014, and I resigned in February 2017.
Can you tell this inquest what was the financial position of the Department of Health in 2009-2010 when you were the MEC there?
The Department of Health, even when I came in 2009-10, the state of finances was really bad, to a point where on my arrival, I was given a report by the Auditor General to say on the report that was commissioned by SCOPA in the Gauteng legislature about the happenings and the finances of the department and the SAU that processes with the SIU. But the impact of those difficulties at the time, the department was receiving disclaimers and adverse audit opinion. And we worked hard in mobilizing, first of all, in ensuring that we appoint people, and also to ensure that the responsibilities of the civil servants who are appointed on a permanent basis, that responsibility goes back to them. And then after that process, I think we were able to get a qualified audit opinion in the 2010-11 financial year.
In order to do so, can you tell this inquest, who did you work with to accomplish this?
In 2009, in the first time when I was in the department, I worked with the officials because health and social development was combined. So the resources of both the department in terms of skills were very central in ensuring that the Department of Health gets out of the difficulties. And I'm talking about a lot of other young people who have been part and parcel of the system then, like Johann Strauss and many others who worked hard in ensuring that the departments, in terms of the audit opinion, it is improved for the better. Of course, one of the things that was at the center of this was that hospitals didn't have CEOs on a permanent basis. Those we had to make sure that those things are done. And the other impacts related to the finance, because where the finances are not in good conditions and that they've been prioritized to the wrong purpose, whatever. So those we had to rework and ensuring that we mobilize the private sector Of particular importance here was that I think there was an article in the media in 2009, probably many people will remember that, and there was a partnership with private sector companies like Aspen and many other companies that was providing equipment just to capacitate the neonatal ward at Krisane Parakwana. And we worked with the private sector. And that is the important thing here was also that there were no permanent nurses. Like a big bulk of the nurses were not permanent in the Department of Health. They were being contracted via the nursing agencies. And some of them, of course, when my mom was in hospital and ICU at Charlotte for the longest of time, they used to complain to her. When I asked from the officials, they confirmed that, and those nurses were hired on a permanent basis. Part of that was able to stabilize the finances because the nursing agencies were paying a lot of money, and some of the difficulties were arising from some of those things.
Now, in your capacity as the MEC for Health, what were your responsibilities, Ms. Mahlangu?
The responsibility of any executing authority in government post-94, I can't talk in an era before that, is to oversee the implementation of national government policies in terms of, as well as norms and standards set by national government, as well as the norms and standards set by the province from time to time.
The Gauteng provincial government is its common cause, is that correct?
Yes.
How many employees did you have working underneath you at the time?
In terms of the annual report, this is how the best I can account for, which is probably the most reliable information. We had about 62,746 employees in the department, and there was a vacancy rate of about 11.9%. And I think the important thing here is that these are very highly skilled people from level 1 to 2. The percentage probably is the smallest, but the rest of the levels were highly trained people that I was working with in the departments, largely medically trained, from nurses of all categories to doctors, professors, and some of them linked to the universities and all of that.
Were any of these posts joint appointments, and how were they funded?
Yes, some of the posts were joint funded, were joint appointment with the medical schools. They were funded in that. Some were jointly funded, some needed to be funded by the Department of Health, some were needed to be funded by the universities. And this is particularly related to the medical schools because some of the 7 big hospitals in the province are tertiary platforms where medical doctors are training, and nurses are being trained in the different nursing colleges, some of them in the universities. So those training platform provides the hospitals provide a training platform from the doctors from the different respective medical schools to go there. So there was an issue with this joint appointment, and I think later on when we discuss the details about this, you'll see that there was an issue raised by the PwC consultants, which were brought in by Treasury when health was put under Section 18 of the PFMA, being because of its finances. This matter of the joint appointment was also an issue raised by the consultant at the time, and we needed to look into that as well.
In that capacity, did you work with the deans of the medical schools?
Yes, Council, we did a lot of work with the medical deans of the medical schools, because I think the biggest contingent of medical students are trained in the Gauteng-based universities, as the Sfaku University of Pretoria, the Vet University, the University of Johannesburg, had not had the full medical school, but they continue to train your nurses, the radiographers and pharmacists and all of that. So we used to work very well with the universities in dealing with a number of issues, but also when I came back into health in 2014, just to give a context, when I was there in 2009 to 2010, I think the department was funding about 10 medical students training in Cuba. When I came back in 2014, there was at least 100 students that were being trained in Cuba. And that needed us to work with the medical schools and the deans in particular and their teams to ensure that when the students come back from Cuba, have a platform to go back to in the respective provinces in our health facilities, but also the fact that we needed to create an environment post and also resourcing of that program. So that's why we were really working with the deans of the medical school in the greatest of detail and have workshops and the different interaction in dealing with that.
Just for clarification, those deans and the students all related to medical students, is that correct?
Yes, Councillor, that is true.
Now, moving over to the National Health Council, which is referred to as the NHC, did you attend any meetings there?
Yes, Councillor, I attended almost all the National Health Council meeting convened by the Minister, attended by the Minister, Deputy Minister, and all 9 MECs, together with the respective HODs. The meetings will be on 2 days. We'll start Wednesday night with the political meeting, and then on Wednesday night, the political meeting. Thursday and Friday, that will be the National Health Council meeting with the Minister and, as I said, with the respective MECs from other provinces, together with our HODs.
We had a meeting on the Wednesday evening that was followed with meetings on Thursday and Friday, as I understand you. Is that correct?
Yes, that is correct, Councillor.
Now, were you involved in the Gauteng AIDS Council?
Yes, the AIDS Council is led by the Premier of any province, as the National AIDS Council is led by the President, who's assigned to the Deputy President. So the AIDS Council in Gauteng is led by the Premier, and the MEC for Health, together with the Department of Health, provide support to the AIDS Council. And the AIDS Council also was held, I think, on every quarter or every 2 months, if I'm not mistaken. I don't have the details in front of me, but that will also involve discussing programs relating build up to World AIDS Day, looking at the respective programs of what government and the relevant stakeholders are doing to ensure that the AIDS work, the work that is being done in the province related to HIV and AIDS is upscaled and maintained. Where there were weaknesses, those were looked into and addressed based on the feedback from the different stakeholder forums.
Now, over and above the provincial AIDS involvement, were you involved in any international AIDS conferences?
Yes, I attended 2 international AIDS conferences in the time when I was MEC for Health in the last stint, 2014 to 2017. In 2014, I think I was just in the department for 2 months or so. There was a letter coming from the Deputy President's office, sent to the Premier's office, and then we were asked to attend the conference. Yes, I went to Melbourne to attend the conference, and I think 2 years later, the conference was held in South Africa at the ICC, and again I attended that conference together with the officials, and I took part in the respective conferences as to understand and also to participate in the different forum. Of course, the minister was always a leader of those delegations in attending these conferences.
Now, in your capacity as MEC of Health, how many clinics, hospitals, community healthcare centers did you have under your supervision?
Gauteng has a very important, the Department of Health in Gauteng plays a very important function in providing the public health, in the public health system of Southern Africa to say. The 36 hospitals and 36 community healthcare centers located in the respective communities and townships, as well as the 375 clinics. Some are built and run by municipalities. Of course, all the resources there, most of the resources are provided by the province, including pharmacy, including some of the budgets and all of that. So these health facilities, just on their own, they provide a huge service to a huge population of our country, because other provinces do refer their patients to Gauteng. For the reasons that there's very few provinces that have got the depth of, very few provinces have the quaternary and the tertiary services as compared to what Gauteng has. So therefore, people who are really sick will have to be sent to the tertiary hospitals as well as to the central hospitals that were based in Gauteng.
Now, within these 36 hospitals, 36 community healthcare centers, and more than 375 clinics, how many patients were attended to?
Give or take, there'll be, and this number fluctuates, of course, upwards. It will be about 7.1 million, and then I think at some point we did an intensive exercise to look at the number of files that were located in hospitals. There are about 10 million files of patients. So I think it will be safe to say that Gauteng, at least people who are served by the public health system in the province, they are not less than 7.1 million.
Over and above those clinics and those educational institutions, were you involved or responsible for emergency medical services within the Gauteng Department of Health?
Yes, Council. The Gauteng government, as I said, the Department of Health plays a very important role in providing the services. The emergency medical services in the province are the backbone of making sure that patients reach the health facilities on time, based on the calls that have been logged in the system. So the EMS was part and parcel of the department, and it had its own management, of course, as part and parcel of the department. And of course, we were working very close with municipalities for this function, as it is a provincial function, but it was delegated to municipalities.
Right. Now, when you speak of EMS, that's an acronym for Emergency Medical Services, is that correct?
Yes, that is correct, Councillor.
Now, over and above EMS, were you in that capacity involved in medical supplies within the Gauteng Department of Health?
Yes, there's an agency called Medical Supplies Depot, which at some point then was located at Auckland Park. They have regional pharmacies, and it's a huge a pharmacy which dispatches medicines to respective hospitals, to respective pharmacies that are supporting clinics in the respective district, that is Johannesburg, Ekurhuleni, Tshwane, Esidimeni, and the Western, where there is a smaller pharmacy. So like the MSD is like a big pharmacy of the province that is supporting medicines to respective hospitals and clinics throughout the provinces.
MSD that you refer to as Medical Supplies Depot, is that correct?
Yes, it is, Councillor.
Right. Now, I want to just focus for one brief moment on 2014, when you were deployed in 2014 to the Department of Health. What was their financial position like? Can you please tell this inquest?
The state of finances in the Department of Health had not improved much since I had left in 2010. It was still sitting with a qualified audit opinion that I had left with them when I was deployed to economic development in 2010. So when I came back in 2014, I was deployed back in 2014. Actually, the situation had gone worse in that because I knew that things were not very good even when I was deployed. In 2013 financial year, in December, the provincial government took a decision to put the Department of Health under to be supported and assisted by Treasury in terms of Section 18(2)(g) of the Public Finance Management Act, because the finances were really not in a good shape. With that meant that the department would be given extra resources in that PwC was appointed to work with the department. So when I went in 2014, I knew very well that things were not very good because I had been sitting in cabinet and I would hear the reports and all of that. Yeah.
What was the actual technical term for the financial position of the Gauteng Department of Health at that stage?
May you please repeat your question, Councillor?
Yes, what was the actual technical term of the financial position of the Gauteng Department of Health in 2014 when you were deployed there?
It's just escaped my mind. I'll come back to it.
Okay. If I can move on then to your study tours and conferences that you attended in your capacity as the MEC in 2014, could you just tell the inquest which study tours and conferences you attended starting in 2014 whilst you were there as the MEC?
Okay, thank you, Councillor. Maybe I may beg your indulgence, my lady. In 2009 to 2010, when I was MEC for Health, then Health and Social Development, then the Minister of Health, together with the Deputy Minister, the late Dr. Sifularu, there was a trip undertaken and led by the Minister. We went to Brazil, at the time, of course, looking at the NHI, and I think that's a trip that is normally referred to in this proceeding. So I think it's important that I mention that there was a trip in 2009, 10, I can't remember exactly the time and the month, but it was my first stint in health. So in 2014, I attended the conference at the Melbourne, as I did say. I was accompanied by the Chief Director, Mrs. Nomsa Mube, to attend that conference because she's the lead of the HIV work in the province and then all of that. And I think the main issue that we discussed there was about the key population, which your LGBTIQ communities that we studied there. And I also led a delegation to Brazil again in 2015. It was Cuba and Brazil. And that trip, again, we're looking at the broader social transformation issues, which included the MEC for social development, MEC for sports, MEC for arts, culture, and recreation, as well as community safety and human settlement. So again, we went to Cuba and Brazil, and the Office of the Premier was supporting the delegation in that mission.
Anywhere else in 2015?
Yes, and then again in 2015, I traveled to the UK, to England to be exact, with the team from the Department of Health. And why was the trip necessary? Because remember, South Africa or the national government has been talking about the national health insurance, and we thought that we will learn a few things from the NHS system in England. So I took CEOs of respective hospitals. It was Steve Biko, I think, Chrisane Paragwana, Betha Kawa, and I can't remember the few other hospitals. There was another team, of course, that went to the US with the other people. Again, the issue there is we're looking at how the NHS was working and how, because we're also in the process of establishing so-called independent hospital boards, which will help in in gravitating or moving the Gauteng or the hospitals from the current boards, the then current boards, which were simply about community-based, like getting boards that are led by people who've got experience in business, in legal, and all other expertise to make sure that the institution are run. So therefore, looking at the NHS, how things were working there, we needed to expose the CEO in that, but also to, because the NHS is largely run, it's a government-run health system, so we needed to understand how they've got things right, and then all of that. So the CEOs and some of the managers I took were a part and parcel of us helping to navigate through the system in getting the work done as we prepare for the National Health Insurance implementation. And we spent a few days there visiting health facilities, looking at how hospital ambulances will be waiting with patients whilst they're looking for beds and all of that. So it was very interesting for the health managers in Gauteng to have experienced things in the first hand in the respective health facilities that we looked into.
In 2016, did you attend any further conferences?
Yes, in 2016, I also attended as I said, I attended the AIDS conference in KZN, which was the International AIDS Conference. And again, the provinces, because this was hosted in our country, we needed to put up exhibitions to demonstrate the work that we're doing. And we partnered with Kaya FM and other stakeholders in hosting the work that we're doing and showcase. And we had a lot of stakeholders like the NGOs and participating in this. But also the important thing, in addition to the work that I would have done and traveled in 2016, I traveled to the UK again in 2016, if I'm not mistaken, in April. With the Premier to join the Premier. We went to Lancaster University, which is located probably 2 hours outside of Lancaster, between Scotland and London. There again, we were looking at how the government was signing a memorandum of understanding with the Lancaster University together with the Global City Region Academy of the province. I was there in my capacity as the MEC for Health. I also represented MEC Lisufi in that program because Lancaster trains, our interest at the time was that Lancaster trains a lot of health facility managers in the UK NHS system. So this partnership that the province was taking with Lancaster was going to benefit the province in the broader scheme of things.
Now, moving from that topic to your role as a member of the Gauteng Provincial Legislature, which is referred to as an MPL. Can you please explain to this inquest what that required?
Members of the provincial legislatures, we are duty-bound to attend sittings, whether you are debating or not. We are duty-bound to attend, and I need to emphasize that post 2014, the ANC margins in terms of elections had decreased. Therefore, we needed to be in the legislature almost every day, unless, of course, you're hospitalized and you couldn't come to the sitting, or for whatever very important reason. But just generally, you couldn't miss the sitting for any other reason. Therefore, attending sittings, whether you had a subject or not, also answering in terms of the law. If you look at the Constitution and the PFMA, the responsibility to provide answering questions, whether oral or written, to the legislature, present annual reports, present the budget votes, and participate in the debates arising out of that. In this instance, I had a privilege to be presenting the Department of Health budget votes, tabling quarterly reports to the legislature after they've been discussed in the committee, and also taking part in SNAP debates on any matter that the whips in the legislature will decide which a topic to be discussed at the time, and also presenting there's a committee called Standing Committee on Public Accounts. That committee is responsible for looking at post facto activities of the departments after the expenditure when the report is tabled. That's where your issues of irregular expenditure, unauthorized, are dealt with. And also SCOPA looks at the action plan of what departments are putting in place to make sure that the issues raised by the Auditor General are not being raised. So I'll have to attend SCOPA meetings. And I took a decision when I was deployed in the legislature from 2004 that SCOPA meetings, generally, most colleagues will allow the officials to go and present there. I took a decision then that I will always present to SCOPA. The officials will be there to support me, but because I account to the legislature, I'm accountable to the legislature, I took a decision that I will always present and be present in any SCOPA discussions. Of course, where there's technical things being raised, the officials will be there to deal with those.
Over and above the officials, were the community involved? Sorry, over and above that, were the community involved in these engagements within the NCOP?
The NCOP is called National Council of Provinces, which is the second house of in Parliament. It replaced what used to be called in the Senate. In the NCOP, you'll be required to participate in the debates, whether it's in budget votes of the Department of Health, or whenever you are delegated by the Premier to attend the National Council of Provinces debates. So then it means you'll have to travel in Cape Town. And I think in those days, there was not online or as we're doing now. It was a physical attendance to the National Council of Provinces and participate in whatever debate as assigned by the invitation from the National Council of Provinces.
Good. Ms. Mhlanga, moving over to the Social Transformation Cluster, which is abbreviated as the STC. What was your role within the Social Transformation Cluster, or STC?
Okay, so I think what I need to separate the STC, the issues we spoke about early on, Council, were related to the African National Congress in my role as the leader there. So the STC we're talking about now, it was the committee of a subcommittee of cabinet. It's called Cabinet Subcommittees. I chaired was the convener of the cluster, social cluster, which included education, health, social development, sports, arts, culture, recreation, human settlements, as well as community safety. In that role, then the Premier also appoints the HOD, who will support the convener, and Mrs. Shoki Shabalala was the chairperson of the technical cluster, who was all the HODs of the respective department I spoke about were also part of that. One of the main things we had to do after 2014 election, when I was appointed, we were asked by the Executive Council, which is the Gauteng Cabinet, to drive the process of developing the Gauteng social transformation strategy, 2030 strategy. Then we embark on the process of doing that, led by the technical team, of course, the HOD, Shabalala, as well as all other HODs. And we're able to finish that and present it to the Executive Council.
Were you involved in any way in the gender mainstreaming program?
Yes, I was also the chairperson and convener of the gender mainstreaming in the province. Actually, that was from 2006, then when Premier Mbazima was still a premier. And I continued to serve in that committee under the respective premiers, I think between 2006 to 2009. I think 2009, I'm not sure under Premier Mugonyane whether I served in that. But yeah, it's a committee that probably I was serving even under the Premier Makura. I was also the convener of the gender mainstreaming in the province. Of course, that necessitated that I sit with the officials. They develop programs for International Women's Day, which is 8th of March, for Women's March in a month in August, as well as for the 16 days of activism. So that not only develop a program, but also we participate on the ground to do that kind of work as and when the programs are developed, which is happening almost every year and throughout those periods that I've counted.
And at the time, were you involved in the Gautrain Political Committee?
Yes, I served in the Gautrain Political Committee from 2006 again. Till I left government with the respective, under the respective premiers. Probably I'll say I was the longest serving female MEC in that committee. I think when the Gautrain was awarded at the time, I think 2005 or so, the lead person was MEC Mashatile, the deputy president now, and the late MEC Jacobs, Ignatius, and I was the only female there. And I served in that committee right through the process up until I left. Of course, it was modified now and again, but it's one of the committees that I served under.
Thank you. And were you involved in the Natirisani community engagement?
Yes, the Natirisani community engagement, and again, these are activities done led by the Premier's office, which are all MECs are required to participate. And as a chair of the social cluster, if there was any work to be done and make sure that HODs or MECs are prepared for those, as a chair of cluster, you need to make sure that those things are looked into. But also the issues relating to your specific department, you had to make sure that also those issues are dealt with. To be exact, there was a burning issue in the then area of Mitweding now, which is part of Tshwane. There was no hospital there, and there was complaint after complaint. And I think in 2015, if I'm not mistaken, as the issue was raised in the Natirisani meeting, we were able to finalize a hospital purchase from Netcare to be owned by the provincial government. And we were able to provide the community with that facility.
Yeah, but what did this involve? Where did you have to visit, and what did you have to do within the Natirisani community engagements?
The Natirisani Community Engagement Council requires that there will be work done prior. The normally happened on the Wednesdays when I was there. I don't know whether things have changed. The officials will be preparing and looking at the different areas before the politicians come into the area. And on the day when we come to the area, as an example, for instance, you'll have to go to a health institution. If you're in China, they'll identify a health institution that requires, that has challenges. They'll identify a police station, or they'll identify a ECD or an old age home for all the respective departments that falls within the social cluster. So when you start in the morning at 8 o'clock, you'll be required to visit all of those areas. And then you do a briefing as to what has been the observation of all what we've seen, and thereafter go to a public meeting in a particular area where the Premier and all the other MECs will be present there. And then you'll be required to go back in the respective department and as a chair of the social cluster to make sure that we monitor that the departments are responding to the issues that are raised by the community.
Were you involved in the mayoral committees or meetings of the members of the mayoral committees?
Yes, as there is a sorry. My apology for that. As there is a law that governs the National Health Council, there is also legislation that governs how provinces interact with municipalities. Because health, as I said, is in terms of the Constitution, the Schedule B, is that some of the functions are provincial functions that are delegated to municipalities. So amongst other things, I'll have meetings with MMCs of the metros and the districts to discuss issues relating to health, whether be it EMS, be it primary healthcare, which includes clinics, and the running of the services thereof, whether it be staffing. And later on, we also added what was called the National Health, the NHI projects that were being delivered in the respective areas, or the state of readiness of Gauteng, because we said to ourselves, we need to force all, there was a pilot project in the province run by the National Department, and the facilities were largely in Tshwane. We then said, we need to make sure that all health facilities in Gauteng, they begin to do work such that the national health insurance requirements become part and parcel of their daily work as part of our own improvement process to drive change in that regard. So this discussion with municipalities were about those issues related to direct services, primary healthcare, EMS, NHI, and there was something called the non-negotiables that the minister had developed that relating to staffing, medicines, the cleanliness in the facilities and all of that. So those would be the pertinent issues that are being discussed with the respective municipalities.
Thank you, Ms. Mahlangu. I'd like to turn now to the priorities and the pressures that you faced upon your appointment in 2014 as the MEC for Health. So we're going to turn back now to 2014 and when you arrived as the MEC of the Gauteng Department of Health. What did you experience? What was the pressure that was placed on you in that position when you arrived there in 2014?
Thank you very much, Council. I just need to also highlight, I think this, I just remembered now, I used to also convene a meeting with the vice chancellors of the respective universities in Gauteng. The Premier established various subcommittees, and one of them was research and innovation, which I was appointed to chair. MEC Mamabulo was appointed the convener of the infrastructure element, and I can't remember the other colleagues who had the responsibility. And that meeting again necessitated that I meet with the vice chancellors to look at issues of innovation, of research in the province, as well as making sure that we align the provincial priorities in relation to research and innovation to the work that are being done by the universities or vice versa, because universities are very good at doing renovation, at issues of research and renovation. So we wanted to tap into that so that the province continued to be a lead in that, as we all know that Gauteng is very strategic in the broader scheme of the Gauteng economy and that of the SADC in general.
Lady, I see that it's almost 11:15. Before I turn to the topic of 2014 and this witness's arrival, perhaps it would be an opportune time to take the short adjournment of 15 minutes, if that would suit your ladyship.
That's fine. Ms. Mahlangu, you have been attending these proceedings. Surely you understand that when the court adjourns, you need not discuss your evidence with anybody else until such time that you shall have finished with your evidence. Is that understood?
Yes, my lady.
Thank you. The court will adjourn and will resume at 11:30.
As your ladyship pleases.
May it please the court, my lady.
Thank you, Ms. Mahlangu. You are reminded that you are still under oath.
Thank you, my lady. Ms. Mahlangu, we now want to turn to what you found upon your arrival in 2014 at the Gauteng Department of Health. Can you please lean forward closer to the screen so that you'll be audible for everybody?
Okay, thank you, Council. In 2014, when I was appointed MEC for Health, and I think I need to say this, on the day we were deployed, we were called to the Premier's office.
We, who is we?
The people were supposed to be appointed to different positions.
Yes.
There were 10 of us in the room, and the Premier came later on and started giving everybody the responsibility, whatever. And when he got to me, he says, I am appointing you MEC for Health. And I broke down. And I said to him, but Premier, this is not fair. He says, I'm taking you to Health. You need to sort out the finances. You're not leaving Health till the finances are resolved. And I cried. MEC, then we were not MECs, Mr. Ismail Vadi and Ms. Sizagele Malovane Nkosi. Nkosi Malovane, they comforted me and they said they will be there to support you. I said to them, you do not understand the Department of Health. And I was very uncomfortable because through the Executive Council, I knew that things have gone from frying pan to fire in terms of finances. I went home, because we went to be sworn in.
Mr. Hodges, I'm sorry to interject. Did you mute yourself, please?
Yeah, I was muted, my lady. It's somebody else
Yes,
that is
but there is this echo. I don't know whether I should also mute myself.
My lady, I was muted. I'm going back to mute.
Okay, that's fine. Continue.
So even when we were sworn in by just President Mlambo, somebody had borrowed me something to wear because I had a tracksuit on. Got sworn in, I went home and I cried because I knew that I was going into a lion's den. And of course, I came back on Monday, asked myself a lot of questions that weekend, but I said, let me go and give it a try. I know that I'm going to a lion's den, but let me go. So a few days after I was appointed, there was a huge hullabaloo about the Charlotte Maxeke as an academic hospital.
Just a second, I'm sorry to interject. I think this echo is getting too much. Nelisiwe, what is it that can be done?
Judge, I think you can also just try and mute yourself on your side.
Okay.
Thank you.
So there was an issue about Charlotte Maxeke having been in a very bad state relating to their responsibility as an academic hospital to train surgeons, that is the cardiothoracic surgeon. And their accreditation status was taken away. And we had a conversation with the Premier, David Makura, and Vice Chancellor Adam Habib, and the team at Charlotte. I think, I can't remember the name, Gladys, forgot her name, Bokhoshi. We had a conversation about what does it mean, the state of affairs, and what needs to be done to improve the situation. So this was the following reason why the status of Charlotte Maxeke was withdrawn, that the Charlotte as a training platform was no longer suitable to train cardiothoracic surgeons. The infrastructure had deteriorated, The theatres were not well equipped, the bed capacity and the consumable goings with that was not also not fine. The training program was not up to scratch. So after talking with the Premier and the Vice Chancellor, and at the time the Vice Chancellor wanted the cardiothoracic training to be moved to Donald Gordon, that facility be capacitated. So in my discussion with the Premier, we agreed that we should do our best to improve the capacity of Charlotte to be able to maintain status. So it needed us to have a team led by at the hospital by the CEO and Dr. Mfukeng. I think she was a clinical head at the time, was leading the team at the practical level in the hospital, and the vets appointed somebody else from the Dean's office to work on this matter. And they were able to, through the work and the resources that the provincial government provided, they were able to appoint 6 consultants and registrars and allied staff, critical nurses, anesthetists, including increasing the bed capacity in the of ICU beds, because when somebody is post-op, they need to go to ICU. And vets, as a university, particularly the medical school, had to revamp its training in line with the international standard. And within 12 months, with relentless work that the team was doing, from time to time I'll get a report and of course update the Premier of what was going. We were able to get this work back on track, and the accreditation status of Charlotte was given, and there were about 200 patients at the time who were waiting operation, and those operations were not being done because of this difficulty, and that matter was resolved, and that backlog was eradicated.
Now, Ms. Mahlangu, we turned on this earlier and you couldn't remember the term, but what was the state of finances when you arrived there?
So the second big issue that was there when I arrived, as I said, early council, that I had known from the Executive Council side, the state of affairs finances were not in order in the Department of Health. The department was under administration, which was the term I was looking for, in terms of Section 18G, 1G of the PFMA. Because the department couldn't, its financial affairs were not in good shape at all. Not only that, so this is the first big issue, is this cardiothoracic and the Charlotte problem. Then the second issue, and now we deal with the finances. So MEC Chrissy writes me a letter on the 12th of August, 2014. And in this letter, she says to me that in my capacity now as a MEC, the annual reports have been finished, and now we know that the Department of Health continued to get the qualified audit opinion. And she expressed her concern regarding the audit outcome of the department, which had received a qualified audit opinion, as I said, since 2010 when I left the department. She also raised concern on the state of underperformance of the Department of Health that was undermining the overall performance of the provincial government. And I think the operative word here is undermining the overall provincial performance of the provincial government, and that I needed to do something to put a plan in place to make sure that the department's financial status is approved, and also requested that I must put a work with develop a plan in place so that this matter can be dealt with, that the department achieves a clean audit report in the year ending 2014-15, which would be the 15th of March, as at the 15th of March 2015. Of course, she further directed that I should talk to the head of the internal audit, who will then, the proposed chairperson of the audit cluster, who will provide details and assist the department in getting this work done, and propose that we should have a meeting. So that is really the state of affairs. And I'm talking about, of course, this letter was very concerning, and that's one of the reasons why I was extremely concerned when I was deployed to the department in 2014, redeployed there, that the state of finances have gone from frying pan to fire. And yeah, so basically that's the state of affairs that I found when I got back there.
My lady, for record purposes, the letter that was referred to appears on the page references in this matter at 34619. I repeat, 34619. So it's 34,619. That's the letter that's referred to. Ms. Mahlangu, if I may turn to you then. After your appointment, what did you do?
So after, of course, receiving this letter, and of course, once your appointment, you've got to engage with the civil servants and the respective units in the department to understand where the situation is. One of the things I requested from the Premier after engaging with the officials was that the consultant from the PwC must be removed, and they allow us to appoint, to work with the officials in the department to deal with this work. And yeah, of course, both MEC Chrissy and the Premier, they responded positively to my request, and the administration, PwC was removed, and we're able then to look at other mechanism that will enable us to have a hands-on support with people who will help us to achieve the objective of moving the department to first unqualified before you get to the clean audit report.
What steps did you take once they were removed?
Come again, Councillor?
Once PwC was removed.
My lady, you're muted.
Yes. What I wanted to understand, you say, what did you do after this, after your appointment? If you can just repeat that evidence. I didn't understand what you were saying.
I requested the Premier, my lady, that we should be allowed to put a process in place that will help us to get to improve the state of affairs, meaning that the PwC team be removed, and we get people whom I have confidence that they will help us to do this work and change and help the department to move from qualified to unqualified. Of course, the years after that, probably could get into clean audit report.
Yeah, who did you use to replace the former consultants PwC? Who did you introduce into this program now?
I had worked with SAICA in my previous portfolio in local government, just for your benefit, for the benefit of the court, my lady. In 2004 to 2009, the municipality finances in the province and the audit outcomes were really bad. So we procured the services of SAICA as a professional organization, and they helped us during that.
Mahlangu, when you refer to SAICA, can you just tell the inquest who you're referring to because of all these abbreviations, please?
SAICA, my apology, Councillor. SAICA is a South African Institute of Chartered Accountants. It's a professional, it's the bodies of professionals who are chartered accountants. So in 2009, I had worked with them to support municipalities, deploy retired chartered accountants and chartered accountants who had time to be contracted to municipalities and be based there to help with understanding and improve system. So in 2014, when the Premier allowed us for PwC to move out of the department, I thought it was prudent to bring SAICA, of course, engage with the HOD and the CFO, and then SAICA came on board. And the discussion I had with them in the presence of the HOD and the senior management was that, can you help us to achieve clean audit report? And I remember Mr. Nombe saying to me, but MEC, that's an impossible task. I said, it's okay, but let's try our best. And indeed, finally, they were procured. And I think the document is available. Council has made it available for for the court. In the work that we did with SAICA, first of all, I said to them, I know that this is not going. There's no miracle. I did mirror track that. I said to them, I know this is going to require a lot of work, and our working relationship with you is for a short space of time, but let us give it our shot. And on my side, as the MEC, I will make sure that the officials are available to work with you in supporting the work that must be done. So we agreed that they must deploy the senior chartered accountants in the 4 big hospitals, Chris and Baragwana, Charlotte Makrete, George Mokhari, as well as Steve Bigo, and also to Helen Joseph, Tembisa Hospital, as well as Galafong. In those 7 hospitals, each one of them had a chartered accountant dedicated to them, working with the different senior officials. In the rest of the department, we had some at the central office, which was then Bank of Lisbon, and some of them were deployed to the key, I think 1 or 2 districts, Joburg, if I'm not mistaken. And I then said, once that was done, let's have meetings every morning, every Friday at 7 o'clock in the morning. The meeting will start at 7 and will end at 9 so that people can go back to work and do their work. And those meetings proved to be productive because by the end of the financial year, those intensive 3 months, we were able to bear results, and we got an unqualified audit report.
Lady, as mentioned by the witness, the reference for those documents is pages 51949 to 51959. So it's 51,949 to 51,959. Now, in relation to this, these meetings, is there anything else that you want to refer this inquest to?
I think there is a document which I found in the department then, which was talking about, drafted by the Treasury and the Department of Health, identifying the work of what must be done. And some of the things identified, they related to contract management, related to supply chain processes, related to all of those things that were giving us a difficulties in achieving the unqualified audit opinion. And I think the document was titled Health Support Intervention Proposed Scope, and that work, some of it was taken on by the SAICA team, but I said to them, you must do your own analysis of work, and on the basis of that, be able to decide what needs to be done, because I trust you as a senior chartered accountants, and we've got wealth of experience, and they did exactly that. And I think council can refer you to the respective document. I don't know whether it's been uploaded or not.
My lady, that's been uploaded, my lady, as the consecutive. The next document is from page 51960 to 51989. It's available. It's been uploaded for everybody to refer to. And that's the document entitled Health Support Intervention Proposed Scope, October 2014 to April 2015, Gauteng Department of Health and Gauteng Provincial Treasury. Now, Ms. Mkhlangu, if we move to the next year, now we're talking about 2015 to 2016, what was the outcome financially? What happened there?
We received an unqualified audit opinion, and it was a much relieved outcome, which really reduced a bit of pressure on me, because as you've had the letter and the tone of Mrs. Chris's letter about the department dragging the provincial government down, so it relieved a bit of pressure. And those meetings did not stop, though. We continued with those 7 o'clock meetings, because I believe that there was a lot of things that we could achieve with that intervention and the hands-on support from the chartered accountant from SAICA. And also the department to build internal systems at the hospital level so that you can at any given point in time, the CEOs, the hospitals can run on their own without this hands-on support. If you care to know, Chris Anepara's budget probably is bigger than some of the departments and all of that. So you need to have proper systems in place, and the chartered accountants, amongst others, were helping us to do that kind of work.
Okay, now, over and above the financial aspect that we've referred to, on a practical medicinal treatment level, what was accomplished at the actual hospitals that you've referred to?
Firstly, I think the systems were improved to a very great extent, supply chain and all of that. But also, these things are very not isolated, Council. They all lead to each other. One of the other important things linked to these was about improving waiting times, which was really a headache in the province. As an example, I'll get a call, somebody said to me, "Oh, MEC, I've been sending in the queue from 5 in the morning, because if I'm not there by the time the nurses arrive, I will not be allowed into the clinic." Or I'll get a call from the Premier's office or the staff saying, MEC, there's somebody who's complaining, I was driving past this area, the clinic, I found this and that. And of course, with the levels of crime and abuse of women, those things, as we all know, that majority of people who come to the public health facilities, largely clinics, are women, and some of them are senior citizens who get their chronic medication from our different health facilities. So reducing time became a very important issue and priority. The Premier spoke about it in his State of the Province address, about what the need for us to be doing something in improving the services. We then looked at some people came initially proposing that they want to work with the department in supporting the work, was BMGI, McKinsey, and all of that, in just looking at systems relating to outpatients department in hospitals and in clinics. So that work was really important in trying to make sure that people, when they come to health facilities, they are able to arrive and later on still go back to their homes or wherever their errands that they needed to do on that particular day.
Now, when you arrived, Ms. Mahlangu, what was the state of the patient's files? How was that system run? And what did you do in that regard?
The state of patient files in Gauteng, I can't speak about now, but then, and for the longest of time, has been very archaic and very paper-driven kind of a situation, where you will find that a patient sometimes, because they will stand in the queue just to collect the file, probably for about 3 hours. If you like it, 2 hours. If it probably is long, if it's a shorter, maybe we like it to be there for 30 minutes. So then the patients will take the files away home, and some of the files, of course, will be stolen by the lawyers who were wanting to sue the state, particularly for CP cases. So those things we needed to improve. I think, as I said earlier on, Gauteng, give or take, we had about 10 million patients filed in the province that we needed to make electronic, in line with the modernization that Premier would have announced in the State of the Province address. We brought in the Lynn Institute, Professor Norman Fall from the University of Cape Town, UCT, and also that work was not only related to the queues, but also was relating to bed management and to ambulances. Let me explain the relationship of these three things. If a patient is picked up from any area and there's no bed in hospital, and the queues are long, so we needed to make sure that there is an app which helps us to get an app which help people to track the ambulance. When the patient is in the ambulance, you are able to connect, the paramedics is able to connect with a particular hospital to look for beds, because sometimes the ambulances used to move around with patients, not knowing where to take the patient because there were no beds. So the system was enabled, you collect the patient in an Uber type, kind of like an app, and through that app, you are able to connect to the hospital to say, oh, hospital X or Y has a bed that's opening, and all of that. So that intervention was supported by, as I said, by the Lynn Institute, by BMGI and McKinsey and all of that, and also the pharmacies as well. And when people come as outpatients, as part of just reducing these long waiting queues, people in pharmacies, they used to wait for long hours. They'll wait in the queues to see the doctor in the outpatients, whether you've got arthritis or sugar or whatever. And from there, once you've seen the doctor, you must go to the pharmacy and wait for long queues again. And even then, we put systems in place. I think with there was some that was done by one partner at Helen Joseph. We did one at Steve Biko, which is still operating to date. Linked to that Steve Biko thing, also we piloted something like a robot-like project in Alex for patients to be able to go in like in an ATM kind of and get their medicine. All of those things were about improving the patient care and enabling people not to wait in long queues. And those who were stable enough and did not need to see the doctor or sister would not have to come to the clinic, because the ATM will provide their medication as and when they need it and when they are due.
What is the position at that stage in relation to medical legal costs?
Ever since I've been exposed to the Department of Health from 2009, there has always been issues relating to medical negligence. And those problems often were gotten the department assets of the department to be attached by the sheriff, because the department was not able to pay. And when I investigated some of the problems, or when I spoke to the officials to understand, but how do things have to get to this point? They would say to me, no, there was a gentleman, amongst other problems, there were many, but I'm going to cite few. Amongst other problems, there was a gentleman in the state attorney in the province who used to decide on medical legal matters without consulting the Department of Health. A point in case, there was a matter that was decided for about 40 million rand without the approval of the Department of Health. And my lady, these costs are not budgeted. There is no line item in the department that says medical legal. And that's why when I was appointed, the Premier, amongst other things, said all of these things I mentioned, including the dealing with the medical legal, was part and parcel of what we needed to do, because it was eating the budget that was meant to deliver other services in the department. So when that matter was settled for 43 million rand, the department not having been consulted, and we were trying to clean up the files to know which files were. That's why we knew that some of the files were sitting with the lawyers, not with the department. And when the department gets to court, they don't have lawyers, they don't have the file, but the lawyer has the file. We then decided that there was a first thing that we then said we need to introduce mediation. And I think the minister gave us a retired judge who was helping us, holding our hands in just in this mediation. And the mediation was really about, the department should not contest things that were obvious. Where there were mistakes, the department must admit and commit to payment. And that's what mediation was about, so that you remove the third party, which will be the lawyers were there for their own selfish needs. Then the second element was that we needed to put processes and systems in place to know which matters were before court, and there was an entire audit that was done to relate to that. And the third element of this was to say, what other loopholes do we have? Then we engaged with the Judge President Mlambo at the time, and this is a matter of law. I think many lawyers are aware of this, and the judge was very concerned about those matters. We then agreed in the meeting with him with the following, that there is no matter that will be settled in Gauteng without the approval of the MEC, signed by the MEC, so that we avoid these arbitrary awards of huge amounts which were taking resources from the broader services. Secondly, that if the lawyer appears in court having a file and the department does not have a file, therefore that matter they should not even be entertained. I can't remember what was the other things of head. And also that we also wrote a letter to, and I think there was a memo issued to all the chambers in Gauteng relating to this matter from Justice Mlambo. We also took a matter through you, my lady, to court. And I think at the time when I arrived, the matter was before the courts, and there was things that the department's legal team then didn't do. And we started following up this matter thing because I had moved with the gentleman who was the head of legal with me at DID. I brought him to help. So he started checking all of those things. And one of the sorry, my throat is so. My apologies, Justice.
So you streamlined or cleaned up the process in relation to medical negligence cases and the medical legal costs.
Yeah. Can I just finish through you, my lady? Then after that work of just trying to understand what is where and the intervention of Judge President of Gauteng at the time, then this matter that I'm saying was in the legal system and which was not followed properly. We then started to track it down, and of course we didn't file papers right and all of that. But in the end, I think the matter was concluded in 2017. Simply saying that from now onwards, one of the problems relating to this judge, my lady, was that the bulk of the cost relating to this medical legal were going to future expenses. And the department, the monies for past expenses would have, admitting the negligence would have been far smaller than that. I think there was a matter I was reading on this case I'm going to refer to. I think there was a 22 million award for that matter, and 19 million of that was going to future expenses, meaning the expenses that might be incurred if the child needs medical care. The question I asked was, why would the department be paying 19 million for future expenses? Because whilst we have such a comprehensive and a complicated health services, why don't you find a legal way and a manner that will help the department and government not to pay so much money? We admit that things have gone wrong in the theatre when this child was born, and when this mother was in labor or whatever. But going forward, we must commit that the child, when they come to hospital, will treat them. So the matter was really about that. And I think in 2017, Senior Counsel Viewer was able to help, was able to get an established, I think it says common law or law, relating to how future medical expenses will be dealt with in relation to medical legal. So that was an important matter, because if we did not do that, and I think government will continue to be bleeding because of this matter. And the gentleman concerned from State Attorney, of course, we reported him to the Law Society. I had meetings with them, but nothing was done unto it. But we had to do something to arrest this runaway train, which was the medical legal costs. I think at one point in time, we'll pay close to about 300 million rand just on medical legal, on things that are not budgeted for, and the money must come from somewhere to be funding those.
Thank you, Ms. Mahlangu. I'd like to turn now, Ms. Mahlangu, to the evidence that you provided before the arbitration, before Justice Moseneke on the 22nd of January 2018, and it related to a statement that you had previously made, my lady, the reference for this is that the transcript, page 28870, in other words, 28,870, but on the transcript, my lady, that's the testimony that was provided on the 22nd. It starts on the 22nd of January 2018, where Ms. Mahlangu introduced this statement that was then made available to all the participants there and is repeated in her testimony there. Do you have that statement with you, Ms. Mahlangu?
Let me just get my file. My apologies, Judge. Which page?
My lady, the reference is at the transcript, page 28870.
I can't find. May I just get 2 minutes just to look for the file? My lady, may I just, okay. My apology, my lady.
Thank you, Ms. Mahlangu. Do you have that statement before you?
Yes, Councillor.
Please, will you read it into the record, Ms. Mahlangu?
All of it?
Yes.
Is it now the page that you have referred the witness to?
No, my lady, this is, she has the unsigned statement that she had at the arbitration.
And where is it on which page is it?
It was never, there's reference to it in the transcript, my lady, on page 28870. It's the proceedings that began on the 22nd of January.
Where do we get the statement? On which page?
It was never uploaded in arbitration. We can upload it if your ladyship wishes us to do so.
Okay,
But
it's
it was
fine.
never...
Does it say, okay, Mr. Zibara?
Sorry, my lady, I think this statement should have been uploaded with the structure of evidence so that we can have the benefit of this statement before the witness takes the stand. Because we could have consulted our clients with this statement. I don't know these statements. I've never seen this statement. I've read in the arbitration hearing reference to a statement and annexes. I don't know if my other colleagues have the statement. My lady, I don't think it's fair to other parties that statements can be introduced in this way. My late colleague had enough opportunity and time to have this statement uploaded, which this court warned in the previous occasions that we must do the same.
Yes, before I allow Mr. Odes to respond, any other views? Yes, Mr. Martin.
Thank you, my lady. My lady, as I understand it, this statement was read into the arbitration record.
Yes,
and it appears right there in the transcript. I recall from when Dr. Manamela was led that her counsel took her extensively through that very same transcript, not necessarily this page. But I'm not quite sure why this would suddenly be a surprise to everybody. It's been part of the document since. I'm not quite sure why this would be a surprise to everybody. This transcript has been available since the beginning of the matter.
But what I understand from Mr. Odes is that the statement has been read into the arbitration record.
Yes, it's right there.
Yes. So the statement is right there.
It's there and it has been there for the entire time. Now, the independent statement itself might not have been uploaded, but its content was read. That's my understanding.
Okay. Is that the case?
Yes, my
Mr.
lady.
Hodges?
Mr. Martin is correct with respect. The entire statement was read out, my lady, and the witness was cross-examined extensively in that transcript for days on that statement. So I can't see the purpose of having to now independently upload it or not be prepared on the basis that you haven't read the transcript, because it's very clearly referred to there. It's read out word for word, and it's cross-examined on extensively. With respect, my lady. May I proceed, my lady?
My lady, we may proceed.
Thank you. The
Thank
witness
you, my
can
lady.
proceed.
Thank you, my lady. Ms. Mahlangu, would you please read the statement onto the record?
I, Qetani Dorothy Mahlangu, hereby state that introduction. The loss of life our country experienced following the termination of life Esidimeni service level agreement is certainly one of the most painful ever incident in the history of the South African healthcare. The death of approximately 140 mental health care users is indeed painful and regrettable. I want to upfront express my sincerest condolences to the family who lost their loved ones following the termination of the Life Esidimeni Service Level Agreement, including the removal of mental health patients from the Life Esidimeni healthcare facilities. Our healthcare system is meant to preserve, where humanly possible, to prolong life. In this regard, our primary role as the department in the transfer of patients from Life Esidimeni was to ensure that we deliver service to the people, to all the people of Gauteng. Clearly, this did not go according to plan. It is indeed unfortunate, deeply regrettable that implementation of this project ended up with a tragic loss of life, and I'm sorry that innocent and vulnerable members of our society lost their lives in the process. I hope that my testimony at these hearings will help families to find closure and also explore the consequences to be faced by all who were involved and or play various roles that led to the system failing the deceased, their families, and the public at large. It is important to state that Life Esidimeni project had good intentions of firstly, the institutionalization of mental health care patients in line with the Mental Health Act. In other ways, the reason for the project was to integrate mental health patients into the communities instead of keeping them permanently institutionalized in hospitals. For far too long, mental health patients have been treated as social outcasts, and this took place against the accepted international practice, which seek to ensure that mental health patients become part and parcel of society by ensuring that they wake up and live amongst members of society instead of being locked up in some mental institutions.
My lady, my apologies to interrupt Ms. Mahlangu. My apologies to Ms. Mahlangu. My lady, I don't know if I have lost the page, but it seems to me that what Ms. Mahlangu has been reading deviates from what was found as recorded in the arbitration record. Perhaps someone can just assist me if I missed out somewhere. But from the point of page 28871, approximately line 10, what was read by Ms. Mahlangu did not accord with what is on this page.
Just a second, what I pick up, even from the first page, 28870, there is a portion where she says other things, although it's not that much. And that is what has happened in the next page, 28871. Perhaps it's better, Mr. Odes, she can continue while that independent statement is uploaded on Caseline.
My lady, we will attend to that.
Okay, thank you.
Thank you.
Will that be fine, Mr. Van Bergen?
As your ladyship pleases.
Thank you. You may proceed.
I lost where was I? Okay, let me start the 5.1. Firstly, the institutionalization of mental health patients in line with the Mental Health Act. In other words, the reason for the project was to integrate mental health patients into their communities instead of keeping them permanently institutionalized in hospitals. For far too long, mental health patients have been treated as social outcasts, and this took place against the accepted international practice, which seeks to ensure that mental health patients become part and parcel of society by ensuring that they wake up and live amongst members of society instead of being locked up in some mental institution. Secondly, the project was also responding to various negative findings by the Office of the Auditor General on the Life Assessment Level of Service Agreement.
My apologies, my lady. Can you hear me? I'm sorry to interrupt, Ms. Mahlangu, but it's hard to follow the statement and read the transcript at the same time because it deviates. And I wondered whether it would be possible to sort of present the statement on the screen so that we can at least follow on the screen.
Yes, but in any event, what I pick up here, I just before you interjected, I was looking at the deviations and I saw that now it's getting to the extreme. So what should happen is that the statement must be uploaded and it must also be displayed on the screen. Otherwise, we'll have to take an adjournment so that the statement can first be uploaded on Caseline, if that is possible. Okay, I think Mr. Late can help in this regard. Perhaps we should take a 10-minute adjournment for the statement to be uploaded.
Yes, your ladyship pleases, we will attend to it.
Please attend to that as soon as possible. The witness is warned. Thank you.
Thank you, my lady.
opportunity to look at the document that has been uploaded, or the witness can just proceed and then we see how far we go. We break at lunchtime.
Happy to proceed, my lady, till lunchtime.
Yes, Mr. Pina?
Request before we proceed that the document just be properly uploaded as an exhibit and be identified. That's now been presented, and then I would submit. I don't know what my colleague's situation is, but maybe it would be more prudent if everybody is granted the opportunity to scrutinize the document as it's been presented and uploaded, and then we can proceed after the lunch break, my lady. May it please the court, my lady.
Yes, Mr. Late, where is the document?
My lady, if I may be of assistance, the document has been uploaded at pages 52334 to 52346. I apologize for the inconvenience caused, my lady, but it is uploaded. And if Mr. Pino wants to peruse the document in advance, there's not much time. It's 15 minutes until the lunch adjournment, and I have no difficulty, my lady.
I don't think it's him alone.
No issue, my lady.
Can I just find out, Mr. Late?
I am here, my lady.
Does this document not form part of the record? Because it is, I don't know, we didn't have it. So it must be admitted into evidence as an exhibit at a later stage once the witness has finished testifying.
As soon as the witness identifies the document as a statement that she had made for the purposes of the arbitration, it can be entered as an exhibit, my lady.
Okay. Can we now adjourn the proceedings, take the tea adjournment, and then we will resume at 1:45. The witness is one. Yes, Mr. Late, you wanted to say something?
No, I say, as the court pleases, my lady.
Yes. The court will take a lunch adjournment, and then we'll resume at 1:45. Thank you so much. The witness is one.
May it please the court, my lady.
My apologies again, my lady. Before we adjourn, I see that page 3 of the document wasn't uploaded. I don't know if any other pages were missing, but perhaps during the lunch adjournment, Mr. Hodis's team could just have a look to make sure all the pages are there.
Okay, thank you very much, Ms. Asif. Thank you. I think that has been noted, Mr. Hodis.
Thank you, my lady. We will attend to that.
Thank you, Mr. Pina. Do you still have something to say? Mr. Pina? Okay, thank you. The court takes a tea adjournment, a lunch adjournment. Thank you.
Yeah, my lady.
Yes, Miss Mahlangu, you are reminded that you are still under oath. Can I just check? Did you manage to read the statement, Mr. Pinar and others?
May it please for the indulgence.
Okay, thank you so much. You may proceed, Mr. Hodes.
My lady, the page references for which I'm indebted to my colleagues are as follows. It's 52334 to 52347. In the first version was uploaded upside down. That's why it took so long. And the second version was missing page 3, but now I understand that it's correct.
Okay. Thank you so much.
We were on paragraph 5.2.
Come again? Where are we now?
Paragraph 5.2, which will be on page 52335.
Just a second, Ms. Hasim.
Lady, I'm sorry to interrupt again. I just wanted to query, I'm not sure I see it here, whether the annexures to the statement are uploaded or whether they will be uploaded.
Just a second, I'm checking something. I see the statement consists of 14 pages.
Yes, my lady. My lady, the annexures, this document for some administrative error during the arbitration when we weren't involved wasn't handed in, even though I understand it's on the list of exhibits. The annexures are to a large extent duplication of annexures to the warning statement, which is my next document that is part of the record that I will be referring to. I will give the respective page references, and where they have not been uploaded after the statement, I'll give you the page references where they are already on the record or have been uploaded by us recently, but I didn't want to duplicate them again and again each time. So I'll give the cross references as we progress. Should it happen that there's a document missing for any particular reason, we will upload it immediately, and we apologize, but I do believe that they are there and we've been through them. They are duplicated, not fully, but mostly in the QDM annexes to the warning statement. And if any of my colleagues require any page references or cross-references as we proceed.
Yes, we need, as she testifies, perhaps we should be guided by you as she gives the evidence.
My lady, I don't know how to work case lines, but my junior and my attorney are both very proficient, and they'll give us all the references as we proceed.
Okay, thank you so much.
Thank you,
I'm grateful to my colleague.
Okay.
No, thank you to you, because you pointed out the missing page. So I'm grateful to you. Thank you. We were on what would now be page 52335, page 2 of this statement. Ms. Mahlangu, you had just completed paragraph 5.1. And if you could continue from paragraph 5.2, please.
Thank you, my lady. Secondly, that is 5.2. The project was also responding to the various negative audit findings by the Office of the Auditor General on Life Esidimeni service level agreement. In simple terms, Life Esidimeni enjoyed the benefits of a contract that existed since 1979 without it going out on tender as required in terms of Section 217 of the Constitution of the Republic of South Africa, as well as the Public Finance Management Act and the Preferential Procurement Policy Framework Act. 5.3, Section 217 of the Constitution requires all state organs of state to procure goods and services through a system which is fair, equitable, transparent, and cost-effective. In other words, the fact that the Life Esidimeni enjoyed the benefit which did not comply with the provision of the Constitution was in violation of the Constitution. I have taken liberty to appear in these proceedings, then in the arbitration, and now in this inquest, to share with the arbitration then and now with the inquest, the family members of the deceased and the public, the factors relating to the Life Esidimeni project, which are within my personal knowledge at the time. The statement has been prepared, which provides chronological sequence of the events relating to the Life Esidimeni project. And at this point, Madam, my lady, I want to say to the families who may be watching these proceedings, wherever they are located in the corners of our country and province, those who've lost their loved one as part of the implementation of this project, I am deeply sorry that you've lost your loved one, and may their souls rest in peace. My life has not been the same ever since this. I continue to receive counsel from my psychologist, and it's not been easy. And my lady, I wish to really give account of my involvement as the MEC then with regards to the implementation of this project. And by way of background, shortly in 2014, after the general election, I was duly appointed as a member of the executive then by the Premier of Gauteng, Mr. David Makura, as the MEC for Department of Health. He wasn't referred to as a Gauteng province. By virtue of my appointment, I became the executive authority in line with the PFMA of the Department of Health, and my duties were largely prescribed by the Constitution, the Public Finance Management Act, and other supporting legislation. I had the responsibility to oversee implementation and development of government policy in line with the mandate of the Department of Health in Gauteng. The department had financial constraints, and some of them I've alluded to earlier. And the department was under administration in terms of Section 18 of the PFMA Act number 1 of 1999. The cost of healthcare continued to increase, leading to budgetary constraints.
I'm sorry, just bear with me for a second. Yes, you may proceed.
At the Premier's Budget Committee, which I was a member of, and also would be there to present on behalf of the Department of Health. The meeting was held on the 14th of November, and the Department of Health, as part of all the departments in Gauteng, was requested to present, and one of the things was we were asked to include, in terms of the template, was to include issues relating to reducing cost where possible and ensure that the over expenditure in the department is reduced. By way of example, through you, my lady, there is a presentation that I shared then in arbitration, and I think it's been uploaded on the case line in the records. The first presentation that I made on behalf of the Department of Health to the PBC, the Premier's Budget Committee, the cost containment that we included then did not have the item that was subsequently added.
Lady, this is uploaded at pages 51995 to 52135. It had been uploaded in advance of today's hearing.
Can you give those?
Yes, my lady.
Yes.
515. So it begins 51995 to 52135, my lady. It's the cover page says Gauteng Department of Health PBC presentation for health. MEC for Health, Ms. Kodani Mahlangu, and the date is 13 November 2014, my lady. But it is uploaded for all my colleagues at 51995 to 52135. Thank you.
Yes, you may proceed.
And by way of demonstrating this, my lady, the cost containment that were included in that presentation from slide number 85 to be exact, were compensation of employees, and are specific to that effect, the medical gas, the medical waste, the laundry services, the vaccines, the litigations, as I've spoken to about earlier on, reduce the expenditure in relation to the National Health Laboratory Services with the NHLS, decrease wastage on blood services and blood products, reduce the cost of pharmaceutical items, reduce the cost of servicing medical equipment. Those were the cost containment that the department had brought up and presented to the budget committee. In response to the PBC, which is I'm on paragraph 12 now, the decision referred to above, we were told, the department was told through me, of course, and the officials who accompanied me to the budget committee, that we must go back and look for items or contracts or activities in the department which will help the department, which are also not in keeping with the PFMA or the Constitution, and that will help the department to reduce cost. And the officials went back, led by the HOD and the CFO, and the team at large. They came back, and the presentation, I think in the document, is referred to as slide number here to Annexure A or Mark A. The HOD also shared this presentation with Provincial Treasury.
My lady, the reference for Annexure A is the cross-reference is QDM1, and the record page is 1692. I'll repeat that for my colleagues. The cross-reference is QDM1, and the page reference for Annexure A, which is QDM1, is 1692. It's a document headed Cost Containment and Revenue Enhancement Measures, Premier Budget Committee, 15th floor boardroom, East Wing, and it's dated 26 November 2014, my lady.
Okay, on paragraph 14, the plan area included, but not limited to, the termination . My lady, can you hear me?
I can hear you, but I can't see your face.
Well, my lady, there was load shedding in the building. All my colleagues in this building would have suffered that as well. So the power temporarily cut. We're on an alternative power supply.
So what are we going to do, Mr. Hodes?
Now we can I can see the witness.
Yes, but I cannot see the witness. Can any one of you see the witness?
I can't, my lady.
I can see her, my lady.
You can see her?
Yes.
Yeah, but she's not yet. I can't see her. Mr. Van Bergen, can you see her?
No, my lady, I can't see either her or Mr. Hodes.
Yes, both of them, I can't see them.
My lady, I could see the witness, and now she's gone.
I can't even see you, Mr. Hodes. Yes, the witness is back now, but now she's gone again. Yes, I think Mr. Hodes is not yet visible.
Onwards, the National Health Laboratory Services. And the important thing about the NHLS, there was work done independently by Treasury through, I can't remember which company, which had shown that there was a lot of blood tests that were done in Gauteng hospitals. Some of them were patients who were not necessarily public patients, were private patients, yet their blood tests were done in the province, in the public sector, and there were a lot of other issues there, and that the department was owed a lot of money. So putting systems in place to make sure that this is done efficiently was necessary. The laundry services, important thing to note here, the laundry services, whenever there was the laundries in the province were not functioning in the respective hospitals, including the Masakane laundry, those managers who were running the services would quickly adopt to work with the private laundries, and the department was incurring a lot of costs relating to that. Of course, the road accident fund and stationery. So all of these items combined, I think when the officials worked on it, they came to about plus minus 700 million that could have been saved out of this. And out of one of the first cost-cutting exercises to be implemented, which again, the service provider was very unhappy about it, but the premier went to the premier, and the premier subsequently called me to a meeting, and I took the officials with me. As a matter of fact, my lady, in everything I did in the Department of Health, I will not go to a meeting without being accompanied by the HOD or a person that he has designated, or any other medical professional, be it a nurse, depending on what the area and the discussion has been. And that is very, very important for the purposes of our discussion. And the CELP contract, as I said, it attracted the comments from the Auditor General that the contract was being renewed without following supply chain processes. This was due to the fact that the provincial government had built Jabulani District Hospital, which is Begimlangeni District Hospital, was located there in Soweto, and and as well as Pretoria was the new hospital was finished and built, and therefore these two district hospitals were meant to take the patients that were down referred to life. And how did CELB Hospital came about? I think the history is important. I think in the early 2000s, when the HIV became a big problem in our province and country.
Where are we now?
We're on paragraph 16, madam, my lady.
Okay.
I'm just giving a context.
Yes, but I was thinking that I don't know how your consultation with your council went. But if you can just read the statement, these clarifications, council can just deal with them. Otherwise, one is going to be lost because everyone is following the statement.
Yes,
we are now at paragraph 16. Just read this statement into the record, and then the other things that council would want to clarify, he will do that.
Yes, my lady. The points I was referring to, they are in the statement. This was due to the fact that the completed two hospitals.
I'm just worried. As you read the statement, you keep on adding other things. So it's going to create a problem. So I'm just saying, just read the statement. And if there is anything that you want to clarify, council can always take you through that.
Okay, my lady.
Yes. You can start by reading this paragraph 16.
Selby Park Clinic attracted comments from the Auditor General that the contract is being renewed without following supply chain processes. This was due to the fact that the contract the government had completed two hospitals, namely Pretoria and Begimlangeni district hospitals. A comment that the provincial government needed to utilize these beds from the newly completed hospital will result, if the provincial government does not utilize this bed, this will result into fruitless expenditure because we've got new hospitals, beds are not being occupied. Yes, we continue to provide services through the private sector. Paragraph 17, for the sake of completeness, I wish to state that the life Esidimeni contract had continuously created an audit query due to its perpetual nature. This life Esidimeni contract can be traced as back as the 1st of August 1979. according to the document at the disposal of the department. Furthermore, that the department had been unable to maintain the cost related to the life Esidimeni agreement for the considerable amount of time. Whatever was budgeted for, the expenditure will be more than what was budgeted for.
I'm going to ask you again just to read the statement. If there is anything for clarification, your counsel will take you through it.
The HOD, assisted by other officials, departmental officials, developed the Life Esidimeni implementation plan, which is annexed here to a marked B. In addition to the implementation.
Just before you proceed, Mr. Hodes, Annexure B can be found on what? Which pages?
1068, my lady.
Yes, continue.
In addition to the implementation plan referred to above, the officials in the department led by the HOD developed and presented to me the template against which the NGOs which were to take over the Life Esidimeni MHCU would be assessed, and a copy of that template is also attached in marked Annexure C.
Yes, page?
51264, my lady. I repeat, 51264.
Thank you. Proceed.
The department also established the Life Esidimeni project team, annexed here to marked D. A list of the members of project members is also reflected in there.
Mr. Hodes? Mr. Hodes, are you there?
I apologize, my lady. It's at page 1070, my lady.
I see you are no longer visible. I don't know what's wrong with your camera now. Okay, continue.
I was advised by Dr. Silibano, which advice I accepted and relied on, that prior to the termination of the Life Esidimeni contract, which he sourced and obtained a legal opinion which advised the department that can terminate the Life Esidimeni service level agreement. I do not have a copy of the legal opinion with me, but I'm sure I have a reason to believe that the department has a copy, and probably the inquest has seen the copy by now. In line with the PFMA and other legislation, I provided guidance when I was required to do so. Informal mitigation was dismissed. In January 2016, the department was ready to meet with the families of the patients to be affected by the move from Life Esidimeni. In this regard, we agreed with the HOD that I would visit Waverley to meet with the families, whereas the HOD will visited Randfontein to meet with the families. During my meeting with the family members in Waverley, we discussed various aspects related to the move, and we suggested that they must form a family committee. And I also shared my personal mobile number, which was paid for by the state, with the families so that they could ask any clarity and discuss other matters relating to the move thereafter, or to report officials if they were not listening to the concerns of the families. Once again, I wish to state for the record that I was never informed of any major problems other than the teething problems I've mentioned to relating to the patient's files, as well as the food, the clothing, and the medicines that I referred to earlier, with the implementation of the termination of the Life Esidimeni contract. During the course of the meetings, it was reported that some patients had arrived at Vescopis and Sterkfontein with single clothing items, some with one pair of shoes, and others with one shoe. Others on arrival were weak and malnourished, and immediately they were taken to Galafong Hospital. In one of the interviews I had with 782, if I'm not mistaken, with John Robbie, wherein I made a plea for members of the public to assist.
Hi, Jude. I'm finding you. Miss Sivoko? Miss Sivoko? Please mute yourself. Continue.
During the course of the meetings, it was reported that some patients had arrived at Vescopis and Sterkfontein with single clothing, some with one pair of shoes and others with one shoe. Others on arrival were weak and malnourished, and immediately they were taken to Galafong Hospital. In one interview which I had with John Robbie, if I'm not mistaken, wherein I made a plea for members of the public to assist with donations on items such as clothing, pajamas, tracksuit, and shoes for the patient, for the benefit of the patient. After the project team had completed the scoping of the project and entering the implementation phase of the project, the process of moving patients to various facilities was commenced with. I must add that with the Life Esidimeni, when Life Esidimeni released the patients to the various NGOs, it did so without releasing patient files, as I was informed. I had to intervene by writing a letter
It did so without
releasing the patient files.
Okay.
I had to intervene by writing a letter to the Life Esidimeni requesting CEO then, requesting the release of the patient's file. The file was, the Life Esidimeni was uncooperative with regards to the release of the files. The problems persisted until the period of my resignation.
Just hold it there. Just hold it there.
Of the course of the 36th, and to the profile marked Annex E.
My lady?
Yes.
This is duplicated as QDM3 and appears at pages 1714 to 1759. I repeat, it's repeated at QDM3 and appears at pages 1714 to 1759. Thank you, my lady.
Thank you. Proceed.
On the same day, I had a meeting with the minister to discuss the Nelson Mandela Children's Hospital budget. I approached Dr. Mutwaledi, the National Minister of Health, requesting him to assist me because I had spoken to the professor and he was not keen. And the minister indicated that he will engage the professor to assist the department and the Office of the Ombuds to set up an investigation into the causes of the 36th day. I, together with the members of staff, held planning meetings with a view to constitute various a team for the purpose of visiting the various NGOs. If enough help. In Pretoria, I visited an NGO called Precious Angel. I had a conversation with the owner of the NGO had received no payment from the department. Upon probing, I discovered that the NGO was not registered with the provincial treasury. I immediately requested the HOD, the CFO, to assist the NGO with the necessary registration and the documentation so that it could receive payment. All this happened during the month of September. Small addition through you, my lady. In our Friday meetings, which I've spoken about earlier, before tea, in our Friday meeting, the 7 o'clock meeting, we started monitoring this through the CFO and his team. And to be exact, there are email exchanges between Babita, the late Babita Tikoren, may her soul rest in peace, who was communicating, briefing me on frequent basis about the payment of the NGOs. I'm sure Council will indicate where those email exchanges are as a proof of what I'm saying.
Well, Lady, my attorney is just checking the record to see if they're uploaded, but if they're not, they will be in due course. We're just checking for the reference. I'll come back to your ladyship on that. I apologize.
This is now paragraph 49.
49, yes, Madam Chair.
Okay.
Yes, your ladyship.
Okay. Paragraph 50. I need to mention that around the same period, September 2016, I received several media queries regarding the exact number of deaths which had occurred on the Life Esidimeni project. I continued to receive more questions from the media, who informed me, amongst others, that the numbers of deaths had increased to 68. I did not have complete information regarding the question posed, and I thought it was prudent to subject all of that information to the ombuds. I later requested Dr. Libete to facilitate the performance and finalization of autopsies to register the cases with the police and to have case numbers relating to the same. If I may just add through you, my lady, I also arranged a meeting with MEC for safety at the time, MEC Nkosi Malobane, to appeal to her for this work to be supported by the police as speedily as possible. Throughout the time, I was unaware of the causes of death. I believe that the whole matter required a full investigation. I proceeded to convene the departmental team for planning and visitation to various NGOs. We spread ourselves into different teams, and we were joined by the ministerial team. We then undertook the visits to various NGOs to inspect the infrastructure and to ascertain whether or not there were adequate sleeping arrangement, availability of medication, food, first aid kits, and to assess all the verification in terms of the template the department had developed earlier. The Mental Health Review Board was also part, it was invited as well during this visitation NGOs. I visited NGO, GDOH employees, my lady, the business finance person, and I went to Sirman. I was accompanied by Professor Radim, again with the officials both from the National Department of Health and the province. Amongst the items we paid attention to, in line with the template designed earlier, were availability of nursing staff, security, the toilet facilities, bathrooms, dining places, food, medication, and general conditions of the NGOs. I then gave the directive to the AD and the team to continue to visit the NGOs, particularly where there were challenges, to ensure that these patients were taken care as ensure general compliance to lay. I report for the purpose of the investigation. In correlation, we discovered a number of documents which I was seeing for the first time. Such information includes, but is not limited to, the following: the Life Esidimeni death statistics, covering the period before the termination of the Life Esidimeni contract, which was 2011, and the report of the evaluation of compliance to health and financial analysis report of 2014-15. The copies relating to the reports of the death stats have been handled better and in a manner which promotes human dignity, the right of healthcare, including but not limited to the right to life. I once again apologize for the loss of life during this implementation of the Life Esidimeni project. Thank you.
My lady, the additional documents will be uploaded by my attorney this evening. because they are referred to here. We do have them, but we were unaware that they hadn't been uploaded. There seemed confusion as to what happened during the arbitration, even though they were listed as exhibits. I don't know if they were circulated. I was not involved in the matter at the time. The next document, my lady, with your leave, I'd like to refer to is the warning statement of this witness. It appears, my lady, this was uploaded at page 1675. It's A53 in the docket relating to the matter under Attridgeville 319. It's CAS 319/03/2019. So for all my colleagues, the starting page would be 1675, my lady.
But Mr. Hodes, I don't want to interrupt you. This statement that she has just read, is it not going to be handed in and form part of the record? Can you finish with that so that before we go to other things?
Yes, my
or
lady.
do you want to clear the issue of annexures first?
No, my lady. I apologize.
Yes,
my lady.
please.
My lady,
rather.
My lady, this document was utilized at the arbitration. That was not signed by the witness at the time. So you have it in its original format, my lady. With respect, Watson, or even with the errors that are on it, I would request that because it's a matter of history relating to the sequence of events, that this be submitted as the next exhibit before your ladyship.
Does the witness agree that this is the statement that she herself made? I don't know to who, but I see the statement is not signed. Does she confirm the contents of the statement? Ms. Matam? Yes, you can.
Yes, my lady, I confirm it's a statement I made to the arbitration.
And
just bear with me. I'm just trying to check the annexures.
Exhibits.
Yes, let me just check the numbering of the exhibits. If you can assist Mr. Lead, Miss Marriott, Mr. Van Bergen. Just quickly checking my notes.
Lady, if I'm not mistaken, the last exhibit was exhibit KK3.
KK?
3, lady. So I would suggest maybe we should make this an exhibit L or LL.
Mr. Late?
My lady, I wasn't present for quite a while, but the last exhibit that I have was for page 20483, and that was exhibit KK6.
Okay, so we can go to L.
I suspect so, my lady.
Double L.
Yes, my lady.
Any objection to the handing in of the statement as read out by the witness?
No, my lady.
The statement, yes, the statement of the witness, Ms. Katani Masango, as it appears on pages 5244 to 52347 on case line. It's admitted into evidence and it is marked exhibit LL. Should we make it LL1, Miss Marriott? Or
yes, that's what I wanted to say, my lady. Could we make it LL1, please? Because there's another statement.
Exhibit LL1. Just a second, pages 5, 2, 3, 5, 2. Exhibit LL1.
As your ladyship, please.
Yes, you were busy now with, you wanted to start with the warning statement, and
Yes,
you gave
my
us
lady.
the page as 1675.
That's your ladyship, please. That is correct.
Let me go to that page quickly. Yes.
Ms. Mahlangu, do you have page 1675 in front of you?
Yes, Councillor.
Please, can you proceed to read this on to, before we go there, were you approached by the members of the South African Police Service to make a warning statement?
Yes, Council. I was approached by Colonel Ditawu, who left a note at my house one day.
Fine, we don't want those details. You were approached by the SAPS to make a statement, and this is the statement that you made, isn't it?
Yes, but Ms. Mahlangu, when you were approached to make that statement, you were directed to answer specific questions. Would you confirm that, please?
Yes, Council. I was directed to answer specific questions.
You now have page 1675 in front of you. Do you identify?
I'm having a problem to hear you. I don't know if your colleagues can hear you. You seem to be very far, Mr. And you are also not visible. I don't know why. Because we must have consistency here. You can't do the cross-examination while we can't see you. Please.
No, my lady, I can see myself on the screen.
Yes, but I don't know. I cannot see you myself. And I don't think I'm the only one. Can you all see him? And you seems to be far away.
Lady, I can see both Mr. Hodes and Ms. Mahlangu quite clearly.
Can you see him, Mr. van Bergen?
No, I can see Ms. Mahlangu, but not Mr. Hodes. I can hear Mr. Hodes clearly, but I can't.
Can you hear him clearly?
Yes, I can, my lady.
Because from my side, I can't hear him clearly. Are we the only ones who can see Mr. Hodes?
My lady, I submit that it as a result of the load shedding, the signal is not good enough to send through the picture, but it's strong enough to send through the sound, my lady.
Okay, that's fine. But he appears to be far. I don't know from my side. Miss Hasim, are you also having the same problem?
Lady, I can't see my learned friend, but I can only see the top of his head.
It's even worse. Can you hear him?
I can hear him clearly.
Okay, no, let's proceed then. I hope he's going to be audible on record.
Lady,
yes, you can proceed.
The reason why I only see the top of my head is I'm shouting into a microphone in front of me to try and enhance the sound. So I'm going to try to be as clear as possible. I apologize.
Yes, but let me try something. Just a second. I'm going to exit the meeting and rejoin immediately because I'm not comfortable if I don't see you.
As your ladyship pleases. Lady, we're going to do the same to try and enhance the signal.
You're muted, my lady.
Yes. Mr. Hodes, are you still trying to sort yourself?
My lady, we're trying to enhance the picture. Can you hear me at the moment, my lady?
I can hear you now, but I think I could see you, but now you're no longer there. Maybe. But then it won't be on the 20.
My lady?
Yes.
Thank you, my lady. I've
But
taken
now
it off.
suddenly I can't see Miss Mahlangu now.
I can see her, my lady.
Miss Mahlangu, can you see me?
Yes, my lady.
Now, I don't know.
My lady, may I please exit and come back so that...
I don't think the problem is from your side. You can do that. That's fine.
Maybe can everybody see me?
I see you clearly.
Yeah, we can see you.
Not see her.
Can you all see her?
I can't, my lady.
Yeah, you have the same problem that I'm having. Maybe you just exit.
Okay, my lady, I'm exiting.
Okay. Okay, thank you so much. You may proceed. Where were we?
My lady, I was turning to the warning statement, my lady. It's page 1675, my lady.
Yes.
Right. Ms. Mahlangu, please could you take us through your warning statement that you made at the request of the SAPS?
Excuse me. The warning statement of Ketani Dorothy Mahlangu. Introduction. The purpose of this warning statement is to address certain allegations that were leveled against me and brought to...
My lady, I don't know whether my lady can see me. Your ladyship can see me.
Yes, I can see you.
My lady, I don't want to interrupt Mr. Hades, but I would suggest, like all the other witnesses who made their statements to the police, that she only identify the statement as the statement that she had made to the police, and then hand it in to save some time.
Confirm the contents and then hand it in.
Confirm the content, hand it in. Otherwise, it will take a long time again.
Yes, I mean, unless at the end of the day, whoever wants to cross-examine the witness can deal with the paragraphs.
That's correct, my lady.
Yes, Mr. Hodes.
My lady, I have no objection to following that proposed course of action because I cross-examined law, so I'm quite happy to do that. And
please do. Please do.
Time.
Yes.
Thank you, my lady. I will proceed accordingly. Ms. Mahlangu, do you identify this document as containing your signature and at the end and your initialing on every single page?
Yes, Council, I do.
And similarly, you've initialed all the annexes to it. Do you agree?
Yes, Council.
Did you make this statement freely and voluntarily in your sound and sober senses?
Yes, Council, I did.
And do you recognize your signature on page 1690? Just after paragraph 14, and confirm that you signed it before a commission of oaths on the 24th day of June 2019.
Yes, Council, I do.
Do you further confirm that it was read to you for you to confirm that it's both true and correct before you signed it?
Yes, it was, and I confirmed it.
Similarly, Ms. Mahlangu, would you confirm that you assisted in the compilation of the chronology that was uploaded on your behalf? And I'll provide the page references as well.
Just a few seconds in my file.
It appears, my lady, at 52242 to
Come again?
52242 to 52333, my lady.
52245.
That's 52242.
Yes.
52,242 up to 52333, my lady.
Yes, okay.
My lady, as I outlined in the beginning, that would be the evidence in chief. I beg your pardon, my lady. May I ask that the warning statement be accepted as Exhibit LL2, my lady.
Yeah, just before we do that, Mr. Late, was this warning statement not part of the record?
Just a moment.
My lady, it is part of the report, but in all the other instances, with all the witnesses, we did hand in the primary statements as separate exhibits.
All right. Any objection to the handing in of the statement or the warning statement of the witness?
May it please the court, my lady, no objection.
That will be Exhibit LL2. The statement of the warning statement of Ms. Mahlangu, as it is found from page 1675, is handed in, and it is marked. It is admitted into evidence and marked Exhibit LL2.
As your ladyship pleases. Then, my lady, I would ask that the chronology, which is also part of the record, and I've given your ladyship the page references 52242 to 52333, be accepted as well, my lady, as Exhibit LL3. It was compiled by the legal team, but with the input of this witness, my lady.
Any objection to the handing in of this chronology?
None, my lady.
Yes, the chronology of events as compiled by Ms. Mahlangu's legal team and her, and as it appears on case line pages 52242 to 52333, it's admitted into evidence and marked Exhibit LL3. Thank you. Mr. Hodes?
My lady, may I request a short adjournment? Things have progressed faster than I anticipated. I need 5 minutes, my lady, just to take an instruction.
Yes, as you do that, remember that there were some issues that the witness wanted to add as she was reading the statement. So I strongly indicated that she shouldn't do that so that we could follow the statement. If maybe you can just also check that. All right.
As your ladyship pleases. Thank you,
Yes,
my lady.
the matter shall stand down for a few minutes.
Thank you, my lady.
Okay.
Thank you.
Please let Neni see when you are done, or that's fine. Okay, thank you.
May it please the court, my lady.
Yes, we have reconvened. Are you ready? Mr. Hodes, I thought you were ready.
Lady, I'm not sure if he's hearing you.
I'm surprised because I got the message that he's ready. Now I can't see him any longer. Nelisiwe, can you find out? Okay, here are they.
My lady, can your ladyship hear me on this computer?
Yes, I can see you.
My lady?
Mm.
Can your ladyship hear me on this computer? I've changed systems because that one wasn't coming through.
Okay. We can hear you clearly now.
Thank you, my lady. Thank you. Well, lady, I'd like to refer you to page 52348. Ms. Mahlanga, do you have page 52348 before you?
I have the organogram structure, Council.
Yes, yes. Can you take us through that and explain what it is, please?
Yeah. This is too small.
My lady, the point I'd like to communicate through the structure. I'm not sure whether you've got the one with the table 3.2.2.
We are on 52348. I don't know where you are.
I have loose pages. I have
loose pages. Oh, okay.
Pages of the two pages.
I'm trying to enlarge this because it looks very small.
52348, Ms. Mahlanga, the organogram.
The one
with organizational structure.
Okay. Okay, so my lady, the point I'd like to
yes, with the tables.
Please to communicate with this, and I'll come to the second page. If you look at where the position of the MEC is in this organogram,
yes,
then the next is the chief of staff.
Correct.
And then there's the HOD, the chief of staff in the office of the MEC. And
yes,
give or take, the office of the MEC has at least 6 or 7 people. And it's guided by the ministerial handbook, and it doesn't have people who with a lot of expertise as much as my chief of staff and many other people who in my office were well experienced in the administration and all of that. So below that, you'll have the HOD, and under the HOD, there's this plethora of senior positions, like the DDGs, the chief directors, and some of these, for instance, the DDG for clinical services, you'll have your hospitals reporting to that. You'll have your, and also under the DDG for clinical services, all your provision of healthcare relating to hospitals, the tertiary, regional, as well as the central hospital would be falling under that. as much as at some point we also appointed the CEOs of the 4 central hospitals, upgraded their position to be DDGs. And your primary healthcare services in this organogram will be served under the Chief Directorate that deals with the primary healthcare. That's called Chief Directorate District Healthcare. You will see the branch Chief Operating Office. Below that, there's that.
Yes, I can see that.
District Health Services. Your primary healthcare, your clinics, and all of that will be directly be served under that. And under that Chief Directorate, you'll also have 5 chief directors who are based in the 5 districts of the province, which will be Esidimeni, Johannesburg, the West Rand, Ekurhuleni, as well as Tshwane. And the point I'm demonstrating here, my lady, is that at the time when I was the MEC for Health, the department had 62,700 and something thousand employees under its under PESAL, of course, that including the salary or the individual called the MEC. Those are the 62,000 employees. That this excludes the work that the department was delivering through the NGOs. None of the work, whether be HIV related or be NGOs related, will be reflected in this, because they do not directly report to the department, but they report through the different district offices, which will be primary healthcare will be this, and and all the other areas will be reporting through this. So that's an important point, Madam Chair.
Let me understand that. In relation to NGOs, what are you saying?
I'm saying the NGOs, they do not feature in the structure of the department. In the 62,000 employees,
yes, correct.
There is no NGOs there. And of course, before we get to the NGO, after the 62,000 employees, we also had 5,000 community health workers at the time. Those were community-based people who were liaising between the healthcare system at the community level and assisting the communities, and they will do door-to-door gathering data and all of that and refer people to the health facilities. So below the community health workers, then you'll have your NGOs that are contracted by the department to do certain work, largely on HIV and AIDS, largely on mental health. At the time when I was in health, the second time around, 2014 to 2017 when I left, the department, I was told, had more than 10,000 mental health care users who were already receiving mental health services through the NGOs in Gauteng. And this is the point that being demonstrated here, that at no point will the MEC be in a position to be in touch or do work that is directly in the purview of touching the patient or doing those things. Yes, we make decisions here. You oversee the implementation of government norms and standards. You oversee the overall implementation. But the execution, even some of those people here at the senior management level, they will not be at the forefront of service delivery. That's the point I'm making here, that the point of delivery between the MEC and the actual service delivery is far too remote when you look at the actual numbers of what I'm referring to. That's the first point that I think that I'm demonstrating here. The second point, which is fundamental with the second structure through you, Council. Table 322.
And now you've turned to the next page. It's page 52349. And Ms. Mahlangu, this is page 139 of the Gauteng Provincial Government Department of Health Annual Report for 2014-2015. Can you take us through this document, please?
So, table 322, and I want to confine myself to that for the benefit of the process, my lady. If you look at the breakdown of the skills profile, of the employees of the Department of Health. You'll have the lower level, I'm talking about the cleaners, probably the people who work in the kitchen, the porters and all of that. Probably they'll be level 1 up to level 2, maybe give or take up to level 5. But from level 5 all the way to level 16, you deal with highly qualified people. You deal with people who are expertise in the areas of study, be it nursing, be it doctors, be it dentistry, be it optometrists, be it any aspect of the healthcare. These are all people of authority and highly experienced and highly qualified individuals who are dealing, who will be the core of the Department of Health, the way in which services are delivered. Therefore, in executing any decision in the department, you rely on these cohorts of individuals. To give an example of, now before I get to the example, when the decision is taken, I think this example is appropriate. Between the time in 2004 and 2017, one of the challenges that the department had.
When the decision was taken between?
No, I'm rephrasing the point, Madam, my lady. That the example I want to make in order to demonstrate my point is that between 2014 and 2017, one of the challenges the department had was the surgical backlog, meaning people who needed hip replacement, knee replacement, and all of that. And the list was growing. And you said we speak and sit down with the officials at the management level, the CEOs, and they say, yeah, fine, MEC, we can do this thing. But when you go to the heads of department in the respective hospital, they say, no, but we can't do this. And when you try to understand, but from where you sit at the political level, sitting with management, you understand that the longer you delay to operate someone who's got the hip problem or a knee and they're younger, you are pushing them into the SASSA grants. They will then end up not being able to work and end up in getting SASSA grant. And the sooner you operate them, they'll be mobile and able to do things on their own. So in convincing those who are in the forefront of delivery, you have to sit down and talk. For instance, there was heads of department of the orthopedic surgeons from their respective tertiary and academic hospital. And you said to them, we must do this. They said, no, we can't do this work because once you finish bringing the private sector, they will leave us alone. So we had to convince them, but in the end, they were able to proceed and do this work, and the surgical backlog was dealt with in partnership with the private sector. The point I'm demonstrating that in order for us to, the department at the time, to have even ventured in wanting to deal with the backlog, you had to make sure that the head of the department at the hospital level is, even if they were not in understanding of what you're trying to do, they understand, and in the end they come to the party. Therefore, I had to rely on the expertise of each and every individual in everything else that we do, including on mental health. Specifically, when the time after the PBC had pronounced that we need to do cost containment and life Esidimeni, Selby and others. These were projects relating to patient care, all of them. The clinic in Allies was patient care. Selby was patient care. There were close to 800 patients that were involved in this, moving the patients from the old Natal Spruit Hospital to the new Telemukharane, included patients who were moved in one day. There were about 500 of them, and some of them were in ICU. The point I'm demonstrating here, Judge, is that at any given point in time, I relied on the team. And the team that was part of running this project is the team that also, with the exclusion of the management from the district teams, They were involved in the movement of the patients from the old Nataspreit to Telemukharane. They involved in moving the patients from Selby into Besakawa or to Begimlangeni Hospital. This was the third leg of that work. And at no time or at no point did I doubt that when they say to me, MEC, we've moved to this point or moved to this point, I'll say to them, but you don't have experience, you don't have, you cannot do this work. I relied on their knowledge, I relied on their expertise, I relied on their authority. Some of them are authority on the issue. Dr. Manamela has a doctorate in psychiatry. If she says to me she agrees on a program, I have no reason to disagree with her because she's authority on this. She's got a PhD on the subject. If the HOD says he's my eyes and ears, when there's something I do not understand, I say, HOD, what about this? And if he says to me, MEC, this is a route to go, and I support the decision taken, I have no reason to doubt that. So the point I'm making here, Judge, the decisions, including terminating of life Esidimeni, as well as all the other contracts that were terminated that affected patient care, were done with a competent team, were done and led by people who were authority on the subject matter that they were. Probably I was the only person in the department who did not have a medical qualification or degree, but everybody else below me was or had or is having a medical qualification. And that's the point that I want to demonstrate here.
Ms. Mahlangu, I just want to take you into this document that you have before you, 52349, which is the statistics for the Gauteng Department of Health at the time that you were the MEC. And you will see two columns in both of the tables there.
Sorry, Council, which document? I have loose documents in front of me.
52349, table 321 and 322. You have them before you?
Or 321, yeah? The employment and vacancies.
Yes. Now, if
just hear
now
the
you see at the
question.
top, as you've just said now.
Just a second,
Yes.
Mr. Hodes. Let the witness listen to the question first, because you are referring here to the two tables.
Okay.
Thank you, my lady. You'll see both tables. Thank you, my lady. Both tables have a heading: number of posts on approved establishment, number of posts filled. So you have a summary of all the posts that are available, coming to 71,411. And then you have the number of posts actually filled, which comes to 62,746. What does this number represent?
In simple terms, Council, it says that if the department had all the resources required to fulfill its obligation to deliver healthcare in the public sector, we would have needed then 71,411 employees. But what the budget could take was only 62,746, and therefore the vacancy rate will be 11.9, or give or take will be 12%. So which means that...
So how many employees were there beneath you in that Department of Health?
Okay, so if you remove...
Come again, what is the question?
How many people did you have beneath you in that Department of Health?
If you remove the MEC probably and my office staff, it should be 62,738 or so, because the rest of the people are part of the department. Yeah, so those in my office, both away there in the political office, but the rest probably 62,738. Yeah, those that way I would not count as part of the when my political office, including myself, probably be 8 or 10.
Is it possible for you to meet each and every one of these people?
It's virtually impossible, Council. In that, let me through you, my lady. Even if I would have served in the department for the duration of my term, I don't think I would have been in a position to meet each and every one of them, or to be able to directly interact with each and every program of the department, given the fact that my responsibilities were not only confined with me being the MEC for health. By virtue of being in that position, I was also assigned other responsibilities, so it's virtually impossible.
Okay. I want to take you across, Ms. Mahlangu, to the chronology that was prepared by you and the legal team. It appears, my lady, at page 52242. And I don't want you to read out the whole document. Ms. Mahlangu, we're going to highlight only certain specific events, but feel free to add in as you wish. You'll see that it commences with the date being 1 August 1979, which you've read. Moving through that document, would you highlight certain specific dates that come to mind, please?
My lady, I didn't hear part of the counsel. He was not clear.
There's a problem with connectivity. I'm going to repeat myself. I apologize. Moving through that document that starts on 1 August 1979, would you highlight any specific pertinent dates that are important for the purposes of this inquest? Did you hear me, Ms. Mahlangu?
I am writing the question, counsel, so that I can answer. Okay. I think the first point, my lady, is to say that in 2009 and 2010, up to 2010, when I left the Department of Health, when I was MEC for Health and Social Development, I had interacted with Takalani at the time because there were problems of management at the NGO, and social development intervened. And I think those problems continued, and they were finally the Department of Social Development, as you see, on the 3rd of May 2012, it was the head of department then signed an MOU that Masiko will oversee the day-to-day running of Takalani. Of importance here that Takalani is or was licensed to deal with the severely mentally disabled people. Of course, and I think Dr. Manamela would have said about the issues of AIDS, children, and all of that in the mental health care users that they as defined. So that's the first point I want to highlight. The second one on the second page, the 55243, but when I was appointed a few months thereafter, I think there's a date omitted here that on the 14th of August, if I'm not mistaken, MEC Chrissy wrote me a letter to say that the financial state of affairs in the Department of Health, based on the Auditor General's report, they left much to be desired, and there must be a process in place that is initiated to look into that. So I think that's the omission that is being made there. On the other slide that I want to talk to, I've already alluded to this matter, but I think it's important that I emphasize this, that on the 13th of November, when the Department of Health appeared before the budget.
This is now, you are not telling us the years. So should we assume that that is 2014? Please just be direct.
13th of November, my lady, on page 522.
14 August, is
year?
it 20? Just a second. The previous one, where you refer to this letter from the to the MEC regarding the finances, is it 14 August 2014?
Yes, my lady.
Okay, then you are now talking about November 2014.
November 2014, which
13 November is the one that is here.
Yes, my lady.
Yes, continue.
So the point I want to emphasize here that for every administration after election, when it comes, particular priorities are placed as priorities. When Prima Makura came, he emphasized the issues of radical economic transformation, the modernization, and the department had to align with that. When we went to the presentation is very detailed with those things, and it's been uploaded already. When we went to the budget committee, then, as I indicated, the items for cost containment from the department then did not include the life Esidimeni and all the other direct services that I've referred to. And that is important to mention. The subsequent presentation that was submitted to Treasury and to the Budget Committee, where after the comments of the Budget Committee, that was, I think, the 29th of November, if I'm not mistaken, saying these are the additional things. And at the time, we were asked that we should look at the saving plus minus 700 million in relation to that. And again, if you look at the MEC crisis by medium-term budget policy statement made on the 20th November 2014, issues of cost containment and the revenue enhancement and strategies, those are mentioned, and the Department of Health as one of the big spending department was not excluded from complying with those requirements from the Treasury in the province. As I said, the 26th of November, then the cost...
If I may
assist, 29.
Just a second, I'm sorry to interject. This whatever has been stated here on the 13th of November 2014, just explain to us what do you mean by this so that we can understand, because reading it doesn't help. What are you tentatively saying here?
What I'm saying to the court, my lady, is that on the 13th of November 2014, it was the date the Department of Health was asked to appear or given a date to appear before the Budget Committee. And the presentation had to be in line with the format chair sent by Treasury must comply to when you prepare the presentation before the Budget Committee. And those were priorities set by the provincial government that the Department of Health had to align to those. Those are in the slide presentation, and it's a very thick slide presentation. But just to give a highlight of the contents of the presentation, I'm not going to go into that. It will say the department must talk about radical economic transformation. What does that mean? And what is that the Department of Health will do?
We hear all those. I want you to explain to us in particular. We are here because of life Esidimeni. We hear all these other things. Can we stick to life Esidimeni?
My lady,
what is it that one can pick up from this statement that has been mentioned here about life Esidimeni?
The point I'm making, my lady, is that on this presentation, if you look at slide 82 to 96 of this presentation, there is no mention of the cost containment that includes life Esidimeni. I've referred to those cost containment earlier on when the council was taking me through that were relating to medical gas and then all of that. So the point I'm making is that the origins of the decision of us even tempering or getting into a contract that had the impact on patient, it does not originate from the department. That's the point I'm making. And that's why the points about the format of what we must follow, it's in that slide. The slide is presenting, it indicates that. Then the following slide,
But then from that slide, we progressed from 13 November 2014 to 20 November 2014, which you said was the speech by Barbara Creasy. And then we have 26 November 2014, where life Esidimeni does come to the fore. Could you explain that to her ladyship, please?
My lady, the subsequent presentation asked or requested from on the 26th of November was then saying, go and identify those things that the department will do in order to make sure that we are in line with the supply chain, we are in line with contracts that are up to date, not in contravention with the PFMA or legislation, look at revenues and all of that. That's how the life Esidimeni come in. And through you, my lady, and I'd like to beg your indulgence. There is no item in any of the programs in the department or budget line item that says life Esidimeni. It's a service provided through a broader budget process. That's why I will struggle to simply hone in on life Esidimeni per se, because I ran the entire. I was involved in the entire departmental work, so it's going to be difficult for me to zoom into life Esidimeni alone, because as council was attempted to take me through in the morning about my roles and responsibilities, which is far wider than just one item in that, and that's the point. I think at this presentation, I'm trying to demonstrate throughout what exactly was going on, the origins of the decision, what was the department's approach, what subsequently happened, and from there on, what would have been the developments arising from that.
Then you have the notice, it's common cause that was given to Life Esidimeni. The page reference is on 11 March 2015. And then if you'll take us through to the next important period after the notice of termination.
I've already spoken about the meeting with the NEHAW.
Yes.
And that meeting was occasioned via the Premier's office, as I was invited to the meeting by the Premier's office, because the NEHAW leadership.
Just a second, is it now the 28th of April?
No, we are on the 6th of October 2015.
Okay, yes. Okay, continue.
Yes. That on the 6th of October 2015, because there have been, and I'm highlighting the specific issues for purposes of my role as a politician then. That the meeting, I went to the Premier again. I went to the HOD with someone from communication and one of the, I think, the assistant to the Parliamentary Liaison Office to accompany to the meeting to discuss and the point I want to demonstrate here, I'd like to demonstrate to you, my lady, is that at any given point in time, the Premier was aware of what was happening in the department because he was part of the decision. The meeting with NEHAW, if the Premier was not aware, he would not have agreed to the meeting, would have questioned me why I'm being called to this meeting by NEHAW. He was aware that the NEHAW was concerned. They asked for specific issues relating to the employees of the that were at Life Esidimeni and Selby, and we were asked to give an undertaking that those employees will be absorbed in the department if they met the criteria. And I need to qualify what it means if they met the criteria. Some of them would have left the Department of Health and they were blacklisted through a PESAL and they couldn't come back. So when meeting the criteria, it met things like those and many other things that I may not remember. So that's the point I'm demonstrating here, Chair.
In 21 October 2015 is the date of termination of the Life Esidimeni contract. Who made that decision to terminate?
As I'm demonstrating, Council, that the decision, the Department of Health, when we went to the Budget Committee, these items that are subsequently contained in the presentation of the 26 were not part of this. The decision to terminate was made through the Budget Council, and the Premier was fully alive to all what was happening, including Emi Chrissy, and the fact that the monies saved from the cost containment at the time would have been given back to the Department of Health to direct it back to services because we're facing pressures. And amongst other pressures, as I indicated earlier, was the medical legal services. And I think we're spending at least 300 to between 250 million to 300 million per year on money that was not budgeted for. And all of those things needed to be contained in one form or the other.
We hear that. The question is, who made this decision to terminate the Life Esidimeni contract?
Committee led by the Premier.
Come again?
The Premier's Budget Committee
Led by the Premier.
Yes, and I was part of that committee. I was a member of that committee.
Proceed.
Ms. Mahlangu?
Yes,
The next date? The next date? That's highlighted.
27 October.
No, I won't talk much about this.
27 October 2015. Did you have sight of that letter?
No, the letter was addressed to Dr. Manamela, where the clinical heads were raising issues, and she said she was engaging to those issues when she testified. So I would not have any comments about that.
Okay. Please proceed.
So you didn't have any sight of the letter yourself?
No.
Is that what you're saying?
No, yes, madam.
Thank you. Proceed.
And then on the 26th of November, as I'm saying that the cost containment presentation was sent to the Premier's office. And
26th
of November 2014.
We are on 20. This is 2015. Are we not? Where are we now?
But the council took me back to the Dr. Manamela's letter. So I was like, or maybe I'm wrong.
This was just a second.
Sorry.
The letter is 27 October 2015.
If you look, okay, from where you were on the 21st of October 2015. So the next one is 27 October 2015. So I don't know where you take this, where you get this 2014 from. Ms. Mahlangu?
For the 2014, I was referring to page 52244, but
we're on page.
It was 52246.
Yes, we're at the bottom of 52245. Just assist us to follow your evidence.
No, I swapped the pages around. Sorry, my lady, I swapped the pages around.
Do you see where we are now?
Yes, my lady.
Do you still maintain that you never had sight of this letter that has been referred to here?
Yes, I do maintain that.
Okay. Continue. Mr. Hodes or Ms. Mahlangu?
Yes, Ms. Mahlangu.
And then...
We've now moved to 2015.
Come again?
We're now moving on page 52246 to October 2015.
28 October.
As related to cases.
Yes, anything that you want to highlight here?
Again, the point I want to highlight here, my lady, is that in the presentation made to the budget committee, Premier's budget committee, on page 11 of the presentation, it now reflects that there's reduction in terms of cost containment that has yielded 11 million. That will go to fund NGOs. And in terms of the medium-term expenditure framework, that is called, in short, MTEF, reprioritization, it shows how much money has been reprioritized from this. Again, the point I'm demonstrating in here is that from 2014, the decision is taken. Now, from 2015, 1st of April, this was part and parcel of the budgetary reflection on that the department had already acted in reprioritizing some of the resources in that. So that's the point that I am demonstrating here. And of course, that budget format, and it is implemented through the provincial treasury in the province, which MEC Chris was a leader of.
Okay.
And if you move forward to December 2015, There was an urgent application. Were you aware of that urgent application by SADC?
Yes, I was later informed about it, but I had not involved in the activities preceding to that.
Were you aware of it at the time, Ms. Mahlangu? In December 2015, whilst it was ongoing, were you aware of it?
No, the HOD briefed me about it later.
Move forward. 29 January 2016.
We had a meeting, I can't remember when, in January. I had a meeting with the project team, and one of the things we suggested was that we should visit, interact with the families direct in order to allay their fears. I went to Waverley, and the HOD went to, because the meetings were on 2 separate dates, and he went to Randfontein the following day. If I'm not mistaken, the meeting was on a Friday. And I interacted with the families, and I also gave them my work mobile number, which was paid by the state at the time, and encouraged them to talk to me. And through you, my lady, it was not uncharacteristic of me to share the number with the citizens of Gauteng. At any given point in time, anybody who had an issue at the health facility or anywhere relating to the healthcare service and the delays they were facing, they had all the rights to call me and report on the matter. If you were to indulge me, I'd just like to make one example. There was almost every Sunday, I used to receive a call from patients who would be sitting in queues at Liliangoi. Liliangoi is one of the community healthcare centers just next to Krisani Parakwana. They'll complain about doctors and nurses who are not taking care of them. In response to that, I'll say to them, fine, I'll get somebody to report to deal with the matter, but if you don't get joy, please come back to me. I'll call Mrs. Lerutla, who was responsible for the district health services, and the HOD, and they'll intervene. So at any given point in time, when I say to somebody, take my number and call me back, call me if you don't win, the officials are giving you a runaround. It's something that I meant and I practiced throughout my deployment as NEC at the time.
Then on the 16th of February 2016, there was a memorandum relating to the close of Life Esidimeni. And on the 7th of March 2016, there was a response to that memorandum by Dr. Selabana. Did you have any input in that response, Ms. Mahlangu?
I sincere apology, Council. Through you, my lady, may I just go back to January 18, 2016?
Yes.
I referred to in my
Which date now?
January
18 January 2016. It's the top of page 52248, my lady.
Continue.
This is when the department, through the HOD and CFO, signed the memorandum of understanding with or SLA with the South African Institute of Chartered Accountants to bring SAICA on board so that they can help the retired CAs. I referred to early being deployed in the 4 central hospitals and the 3 tertiary hospitals, were part of this because we needed help. When the officials said to me they can do this work on their own, I said to them, you've lost credibility in this. Let's rather bring reputable organization like SAICA to come on board to help us do this. Of course, at the time, Mr. Terence Nombembe, who's a former AG, had said to me, it's impossible for them to help us get a clean audit. I said, yes, but let's try. And they came on board. And the 7 o'clock meetings were born from that January all the way up until left. We used to have 7 o'clock meetings every single Friday to discuss the state of finances.
Okay. This is what you have previously testified about, isn't it?
Yes, my
Yes,
lady.
ladyship.
Okay. Proceed.
And I had asked you, 16th of February 2016, there's a memorandum from SADC, I beg your pardon, from the families against the close of life Esidimeni, and then there's a response by Dr. Selabana on the 7th of March 2016. Did you have any input in that response?
No, I did not have input in the response, but when the families came to the department to deliver a memorandum, I received the memorandum and I signed for it. I read it and I asked the HOD to help respond, and he responded on all the issues, issue by issue. And I think all of those responses are in the record of this court. And the responses were simply giving assurance that the concerns that the family were raising had no grounds or not grounds. The issues they were raising, the department was dealing with those issues.
Are you saying you received the memorandum and then you directed it to the HOD to respond?
Yes, my lady.
Okay, thank you.
Thank you, my lady. Then you'll see 5 days later, there was an urgent application by SADC, and there were opposing papers filed. This is 12 March 2016, my lady.
Okay.
And the opposing papers were filed, and the opposing affidavits were by Selabana and Manamela, Dr. Selabana and Dr. Manamela. Did you depose to any opposing affidavit in that matter?
No, Kansa.
We then go forward.
It's now 5 to 4.
Perhaps, my lady, this would be an appropriate time to take the adjournment. We've had a long day.
I didn't want to stop you, but...
no, my lady, it would be an opportune time for me.
So you're proceeding with this tomorrow?
Yes, my lady.
Please deal with the issues of the annexures so that everyone can have the opportunity to go through them before they cross-examine the witness. Remember those annexures?
Yes, your ladyship, please. Yes, my lady.
Yes, Ms. Mahlangu, you have been following these proceedings. You are warned that you need not discuss your evidence with anybody else until you finish with your evidence. The court is going to take an adjournment until tomorrow morning. Then you will continue with your evidence.
Thank you, my lady.
Thank you. Court adjourns. We will resume tomorrow. Tomorrow is the 3rd of May.
Thank you. Thank you, my lady.
May it please the court,
Please the court, my lady.
May it please the court, my lady.